Colleagues, it's a pleasure to welcome you here. I would like research that has already been done. I want to welcome you. We're happy actually to be working with the Embassy of Kenya. You have brought successive ambassadors, high commissioners to Kenya, and Madam Ambassador and I met. I think it was in the city of London a couple of months ago, where Mr. Wangi was being given, the second African to be given the freedom of the city, a Kenyan, who really is the founder of Equity Bank. That's where we met, and every year Africa Week showcases Kenya especially. So please welcome to your home away from home at King's College London. Thank you.
Thank you, Professor Fumi. Your Excellency, now we go into two other remarks that are...
Depending on your ancestry, you will be diagnosed, you will respond more poorly to medicines, depending on your ancestry, to certain cancer types. Cancer Research UK is investing $25 million to address that inequity in cancer outcome. This is a partnership led by colleagues in the United States, but co-led by Dr. Sheba Ershad from King's College London and myself in the University of Nottingham. In this ambitious program, we are working with oncologists and pathologists across Kenya, from north to south, from Kisii to Nairobi, where we are going to recruit thousands of breast, prostate, and pancreatic cancer patients. We're going to reverse the historic lack of knowledge about cancer in patients outside of Europe and North America. That knowledge is going to equip us to develop the new therapeutics, the new diagnostics that will transform lives and extend duration and quality of lives. As we look to the future, the global burden of cancer is going to shift from north to south. This work is urgent and is only possible because of the partnerships that had existed between the UK and... So, Mr. President, I want to conclude by thanking...
Excellency, I was actually at LSTM on this program called Bright, that 3 months into that time, we will be signing the MOU today, and then we will move from next week to begin that process. Your Excellency, last we will have an address from, again, one of your friends, Professor Lord Graham, who is from the King's College London, and he'll give his address and also acknowledge one of the guests that we have, who is also another friend of yours, Your Excellency, Professor Orama, who is the President and Chair of the Board of Directors at the Afri-Exim Bank. Welcome, Lord Graham.
Your Excellency, President Ruto, Principal Secretary Aluga, Principal Cabinet Secretaries, High Commissioners, distinguished ladies and gentlemen, and also President Arama, Benedict Arama, my friend who we met in Abuja a few weeks ago. Welcome, all of you. So all protocols observed.
Proud tradition of medical education. Not only that, the Florence Nightingale Faculty of Nursing is also the King's Faculty of Nursing. Now, it has to be said that Florence Nightingale was not a student in that school because she invented the profession of nursing. So she wasn't trained as a nurse. In fact, she was trained as a statistician that most people do not know. She served in the Crimean War. She then created what we now know modern nursing. So we honor our school of
health delivery was in some areas of Liverpool. And so I'm absolutely passionate that we can learn a lot in the UK from the experiences of Kenya as well, which makes it a true two-way partnership. So I'll just finish by thanking you all for coming. Thank you particularly for Your Excellency for being here today. This is a really important initiative for LSTM, and I hope that our ongoing discussions will continue for many years. Thank you.
Thank you, Professor Lalo, and Your Excellency. I have to look at them kindly because when you appointed me to this position, Your Excellency, I was actually at LSTM on this program called Bright, that 3 months into that time, we will be signing the MOU today, and then we will move from next week to begin that process. Your Excellency, last we will have an address from, again, one of your friends, Professor Lord Graham, who is from the King's College London, and he'll give his address and also acknowledge one of the guests that we have, who is also another friend of yours, Your Excellency, Professor Orama, who is the President and Chair of the Board of Directors at the Afri-Exim Bank. Welcome, Lord Graham.
Your Excellency, President Ruto, Principal Secretary Aluga, Principal Cabinet Secretaries, High Commissioners, distinguished ladies and gentlemen, and also President Arama, Benedict Arama, my friend who we met in Abuja a few weeks ago. Welcome, all of you. So all protocols observed. Caribou. Welcome to the United Kingdom. Welcome to London, and welcome to King's. It's a particular personal honour to be giving this address in front of such a distinguished audience, particularly President Ruto. We were discussing earlier, we first met on a sad occasion for this company, for its country, which was the funeral of our former Queen Elizabeth II in September 2022. And that was the first time that you and I discussed the founding of the Kenya-UK Healthcare Alliance, KUKA, that we'd founded a year earlier at the Royal College of Physicians here in London as well, but also how we could continue to build on this partnership. I then visited you in the State House in Nairobi in March the next year, 2023, where we built upon this partnership and how to discuss how we supported universal healthcare and universal health coverage with a particular focus on non-communicable diseases such as cancer, and also healthcare education and training. And around that time, following my visit to the Lake Region Economic Bloc and the governors down there, if you recall, we partnered with Kisii County and Kisii University, but also Maseno, Masindi Muliro, Egerton, Bomet and Kibabi universities. And at that time, your cabinet signed a memo, if you recall, to support the development of a centre for excellence in healthcare education and training. And we continue to work on that project with you. Therefore, it's a particular honour of mine today to see the renewal that you signed with the Prime Minister in number 10 of the Kenya-UK Strategic Partnership that runs now from 2025 to 2030. And the opportunity for King's College London today to enter into a formal partnership with you through KUKA, which is the MOU we'll be signing very shortly. So the WHO, the World Health Organization, predicts that by 2030, which doesn't seem so long away as it did 5 years ago, that 40% of the global shortfall in healthcare workers will be in Africa. That, coupled with the rise in non-communicable diseases, cancer, diabetes, stroke, which due to demographic change and other factors will be the biggest cause of mortality in Africa by 2030, this health partnership is urgent. By sharing expertise across our two nations, we need to reimagine a healthcare system that does three things. One, is sustainable in terms of money and people. Two, is of high quality. And three, provides universal access. Most healthcare systems in the world trade off at least one of those, if not two. And that's not a position that we can accept. King's College London has a proud tradition, as President Kapoor mentioned, of excellence in healthcare, training and research. And just to promote ourselves a little bit. Shitage mentioned Florence Nightingale School of Nursing, and actually this year the School of Nursing, Faculty of Nursing at King's College London was ranked #1 in the world in the QS rankings, an extraordinary achievement. We're also top #1 or 2 in the world for mental health, psychology or psychiatry. Top 5 goes between 2 and 4 in dentistry, and top 10 for the whole of medicine in the world. So why do I say that other than just to be very proud of the university that I now work for? Is that by signing this MOU today, King's College London and other partners within KUKA are committing to collaborate with you and the people of Kenya to not just share our learnings, but to learn from you as friends and partners and countries to try and find solutions to these very pressing challenges. In partnership with the University of Nairobi, as Funmi mentioned, King's founded the African Leadership Centre, the ALC, in 2010, so 15 years old, as you said. Based in Nairobi, the ALC has a number of key programmes in areas such as peace, security and development that enables students to pursue a master's in global leadership and peace building here at King's. The ALC fosters a value-driven, intergenerational community of transformative African leaders. And with the signing of the MOU today, we can now begin discussions at pace as to how we can integrate health leadership into this centre to achieve maximum and rapid impact in the healthcare space. The first strategic partnership between Kenya and the UK was signed in 2020, and that led to the foundation of KUKA in 2021, as I mentioned. And now that our 2 nations, the Republic of Kenya and the United Kingdom of Great Britain and Northern Ireland, have renewed this partnership from 2025 to 2030, I look forward in anticipation to what our next productive and impactful steps will be. Asante Sana.
Thank you, Your Excellency. The King's College London had invited Professor Orama because of the centers of excellence that they are developing in Africa. And they have already concluded one in Abuja. And I've been in conversations, Your Excellency, with Professor Lord Graham that the next center of excellence should be in Kenya. And on that note, Your Excellency, with your indulgence, I would like, with your permission, Your Excellency, to invite Professor Benedict Orama just to make a few remarks, Your Excellency. Professor Orama.
Your Excellency and dear brother, Dr. William Ruto, the President of Kenya, Vice Chancellor of King's College, London, professors, distinguished ladies and gentlemen, Principal Secretary, dear brother. It is indeed a great pleasure to be here with the delegation from Kenya, led by His Excellency President Ruto, to discuss something very important and dear to us and dear to me personally, how to improve healthcare in Africa. President Ruto knows we've discussed this extensively, privately and officially in Kenya and elsewhere. And I'm very, very pleased with the kind of partnership Kenya is building with King's College, because it aligns strategically with what we are doing with King's College London also and King's College Hospital. Essentially, to begin to take our destiny in our hands. To make sure that we develop the same kind of quality healthcare facilities in Africa as exists anywhere in the world. We worked with them and put one up in Abuja, and we thank King's for the partnership in doing so. Together, we've concluded an investment of $300 million and with a target of $750 million, because that facility also includes research and training. And I'm very, very pleased that a lot of work is being done on research in Kenya for diseases that affect people of African descent. That is why we ourselves have also created a life sciences foundation with an endowment fund of $600 million, of which our President has already donated $75 million to support research in that direction. And we hope that we will work with Kenya and King's College in this partnership, KUKA, so that together we will not only do the work that you have agreed to do together in Kenya, but extend it to other parts of Africa. I thank you for your kind attention.
Thank you so much, Professor. And now may we all be upstanding as we welcome His Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto.
Thank you very much. Let's take our seats. Good afternoon, everybody. Kenya and the United Kingdom share a long-standing strategic partnership anchored on 5 key pillars: mutual prosperity, security, sustainable development, climate action, and people-to-people connections. Today, our collaboration is alleviating health budget cuts across the pillars and symbolizes this partnership at its best. The Kenya-UK Health Alliance is a flagship model of what our countries can achieve when we bring together expertise, resources, and shared values. Through the alliance, our two nations are delivering meaningful collaboration in research, clinical excellence, workforce development, and innovation, and helping to strengthen our health systems and improve lives on both sides. The alliance has already brought together renowned institutions in both countries. For example, the partnership between Kenyatta University Teaching and Referral Research Hospital, the University of Manchester, and Christie NHS Foundation Trust has supported the deployment of Kenya's first mobile endoscopy unit to screen for esophageal cancer. Other initiatives include building emergency medical training in Kisii and programs supporting breast cancer patients with life-saving counseling models. I'm also proud of the collaboration between King's College London and health professionals in Kenya to establish a diabetes food center for excellence at the Coast General Hospital in Mombasa. This partnership has facilitated remote consultations, training via digital platforms, and knowledge exchange to address the specific challenges of diabetic food care. Such projects illustrate the Kenya-UK Alliance role in advancing local capacity and delivering care that is tailored to our people's needs. Importantly, these collaborations are sustainable as they are based on building Kenyan expertise. For example, thanks to the partnership led by the Alda Hay Children's Hospital, more than 340 pediatric heart surgeries have been performed in Kenya, with the latest 43 being carried out entirely by Kenyan professionals. Beyond clinical collaboration, our research partnerships are equally significant. The Kemri Wellcome Trust research program demonstrates how shared research can strengthen national health responses. During the COVID-19 pandemic, this partnership delivered vital diagnostic support and evidence to guide our response. Additionally, the US $25 million Sambai Cancer Grand Challenge Consortium is advancing our understanding of cancer genomics in Kenya, building local capacity, and informing better care. Such partnerships are also looking far into the future The Bright Kenya project, in collaboration with the Liverpool School of Tropical Medicine, will help establish local manufacturing capacity for vaccines, monoclonal antibodies, and antivenoms. This will not only reduce dependence on exports, but also strengthen Kenya's role as a regional health hub, creating jobs and ensuring sustainable access to critical medicine. We are also proud of our partnership with universities such as Nottingham, Oxford, and King's College London. These collaborations support training, mentorship, and the development of critical skills to strengthen our medical education and workforce. This is essential to Kenya as we work to expand access to quality care across the country. Ladies and gentlemen, Kenya is fully committed to achieving universal health coverage, a cornerstone of our Vision 2030 and our health sector strategic plan. Through the bottom-up economic transformation agenda, we are investing in a fully and publicly financed primary health care system, the Emergency Care Fund, and Social Health Insurance Fund that will cover all Kenyans. I remember very well when Graham visited me in Nairobi, and I informed him then that if there was one thing that I wanted to do as president was to finally work on universal health coverage. And you have mentioned something very fundamental here. You have said it must be sustainable, it must be of high quality, and it must be, you said one final thing. You said sustainable, you said high quality, and you said it must be universal. Those are the three things I heard you say. And I want to confirm that that is the template upon which we are working on universal health coverage in Kenya. And Dr. Oluga here has clarity from me on what needs to be done. You've just heard the instructions from Graham there: sustainable, high quality, and universal. All right? And it is one thing that I purposed that we must achieve. And I want to give you some good news ever since you left, apart from what we have done with community health workers, which we changed the nomenclature to community health promoters. We now have 107,000 community health promoters in Kenya. Their stipend is shared between the national government and the county governments. Governor Sakaja here, the governor of the city of Nairobi, will tell you he has 7,840 community health promoters in Nairobi. Just one county. And it is the infrastructure that supports health at the very bottom of the pyramid. Every community health promoter has a couple of homesteads to think about. And apart from building that solid base and making sure that these promoters are people who have been trained on the very basics of what to look out in communities, especially when we are trying to attend to them on matters health. But we have also built a bigger ecosystem now. We have transitioned what we had as health. But we have also built a bigger ecosystem now. We have transitioned what we had as just to % for health insurance of their incomes, while the much more endowed members of our society were paying less than 0.1% for health insurance. We decided to make an equitable program to create equity and to create uniformity. So everybody today in Kenya pays 2.75% of their income. For the vulnerable members of our society, health insurance has come down from 10% to 2.75%. For the rest of us, it's gone up from 0.1% to 2.75% of our incomes. And by so doing, we have created sustainable funding. You know, we can now predict with much more accuracy and clarity how we are going to take care of our health infrastructure. In fact, just to give you numbers, by the end of this year, when we are doing the first anniversary, health insurance will pay for 3 times more people than it has done in the past. And we have managed to bring into the health insurance space 3 times more people. In fact, more, because we had about 7 million people in health, on health insurance a year ago. We now have 24 million people. In the last 1 year, we have brought on board another almost 14 million people. And just so that you know how transformative it is, every day, 50,000 on average, between 40 and 60,000 Kenyans register themselves on our health platform. And slowly, progressively, many Kenyans are now realizing the importance of being in that platform. And we are confident that we will be able to reduce out-of-pocket expenditure, fundraisings, and many other things that occasionally become part of health delivery because there wasn't a predictable way of making it sustainable. You find families selling their assets, selling their land, selling their livestock, selling their wares because they want to go and pay for somebody in hospital. We want to make that a thing of the past. On making it high quality, my friend Sakaja here will tell you that we are now working with them on how to have equipment in our hospitals and have those equipments in a way that doesn't strain our budgets. That we've now worked with manufacturers for them to deliver equipment, and we pay on a program of pay for service or fee for service, so that we don't have to buy an MRI, for example, or a CT scan for a hospital. A CT scan is available at the hospital, and we pay for as many times as we use it. If for one reason or another it breaks down, it is the responsibility of the manufacturer to repair it. We will wait. We will pay nothing until they repair it, and then we continue using it. So to create that space, and also to make sure that there are health commodities in our hospitals, specifically to make sure that health is of such quality that it deserves, or our citizens deserve. I'm very happy that President Orama and Afreximbank are working on how we can now enhance that quality, make sure that we have centers of excellence on matters health. And please, Professor Orama, let us have a conversation. You are my friend, at the very least, so that we can have one in Kenya. And thirdly is to make it universal. I mean, there is no other way of making health universal rather than the public sector stepping in for the people who cannot afford. And that is the structure we have built, that while those who can afford can pay 2.75% for indigents, and those who cannot afford to pay, the government of Kenya will step in. because we must make it universal. It must be available for everybody. So I am very happy that we are making this progress together. And this consortium of universities here in the UK working with us in this Kenya-UK Health Alliance is a step in the right direction and has the support, the endorsement of my administration. And you can count on my support and count on my leadership as we work on this together. On behalf of the government and people of Kenya, I express my very sincere appreciation to all the members of the Kenya-UK Health Alliance, to His Majesty's government, and to all our partners for your steadfast support. This collaboration is central to our national development goals and to the health and well-being of our citizens. I reaffirm Kenya's commitment to deepening our partnership with the UK in health and looking forward to welcoming you all to Kenya as we continue this shared journey of collaboration and progress. And I thank you very much.
Development. And let me end on a personal note. Kenya and Nairobi are not strangers to me. My son has been living in Nairobi. In fact, he lives there now with his fiancée for the last 7 years. So as a proud parent, I've visited Nairobi quite a few times. And last year was a big birthday for me. So he said, you know, your challenge is to come with me and climb Mount Lenyana, or Mount Kenya and the peak of Mount Lenyana. So I had the privilege and have had the privilege of being in Kenya and Nairobi many a time. And so therefore I thought that I should end by saying karibuni, if I said that right, and asante sana. I welcome you all and look forward to our discussions here today. Thank you.
Thank you so much, Professor Shitij, for welcoming us. Now, Your Excellency, we just have very short presentations. One that will come from Professor Fumi, who will make very few remarks on behalf of the King's College, London. Professor Fumi.
Excellency, Mr. President, welcome to King's College, London. Distinguished guests, colleagues, it's a pleasure to welcome you here. I would like to add to what our Vice Chancellor has said by making 3 brief points. The first is to talk about the fact that Kings is present in about 28 African countries. And it is deliberate that Kenya forms the headquarters of that presence. And this was an idea that was formed at Kings in the mid-2020s, where we thought that for a growing continent, which we provide 400 million Africans in a short few decades, it was important to put the subject of leadership and interdisciplinary studies and problem solving at the heart of what the next generation does. And that's what occasioned the birth of the African Leadership Center. And Mr. President, we did a survey amongst many of the young Africans studying at King's and who were on our fellowship program and had been on those fellowship programs for a few years. 6 African countries first came up. Kenya rose to the top as the place that could be a continental hub where many young Africans could congregate without xenophobia, without the fear, of fear itself. And my own original home, Nigeria, was on that list. It came last. It's not a thing of pride, but it's just to let you know that Kenya has been the hub for the training of the next generation of Africans for the last 15 years. Secondly, Kenya is the place where you have multi-dimensional partnerships that will combine healthcare and technology and all forms of innovation. And many of my colleagues who study with Kenyan counterparts are sitting in this room. And the subject of healthcare and health, as a whole, sits right at the center of it. And that's why some of the collaborations you'd hear, including ours in engaging our colleagues at the London School and other parts of the UK, would be at the top of the agenda as it should be for this alliance. And I think the third point to be made connects right back to that next generation of Africans, that we realized that fast approaching 900 million young Africans, if they're problem solving, building the elite cadre of Africans who would help lead the solving of those problems is not enough. The entry level, which as you know, Mr. President, that all your counties have been very active in healthcare, in the training of community health care workers. We are adding value to that, and we started a conversation 2 years ago with a consortium of universities, including in Kenya as well, and in 3 other African countries, as our President has mentioned, to then begin to put quality and meaningful employment together, quality education and meaningful employment together in order to provide foundation year education that will take a young person either into foundation year, from foundation year to university, but many thousands of them into the community health workforce, and therefore a progression pathway from that into university sometime later in life. So that lifelong learning is what we're building with our partners to add value to the excellent research that has already been done. I want to welcome you. We're happy actually to be working with the Embassy of Kenya. You have brought successive ambassadors, high commissioners to Kenya, and Madam Ambassador and I met. I think it was in the city of London a couple of months ago, where Mr. Wangi was being given, the second African to be given the freedom of the city, a Kenyan, who really is the founder of Equity Bank. That's where we met, and every year our Africa Week showcases Kenya especially. So please welcome to your home away from home at King's College London. Thank you.
Thank you, Professor Fumi. Your Excellency, now we go into 2 other remarks that are very detailed in terms of the cancer diagnosis and your agenda on local manufacturing of pharmaceutical products. I would like to welcome Professor Mongon from the University of North.
Mr. President, Vice Chancellor, distinguished guests and colleagues, it is my privilege and honour to share and update you on the partnerships and friendships that we have between the University of Nottingham and colleagues throughout Kenya. The University of Nottingham has campuses in China and in Malaysia, and we act as a gateway to enable our partnerships in Kenya to access the technologies and manufacturing capacities in those countries. Kenya is our most essential partner. Our collaborations are built on deep trust and deep friendship. They are long-lasting and enduring. They are built on networks that have been built over years and that have been sustained through mutual benefit and reciprocal respect and benefit to all of our societies. But we are impatient. We want to do more. I'm so grateful to the leadership of John Guto, who has continued to make pivotal introductions to us so that we have continued to expand our partnerships throughout Kenya. We have started to explore how we can work better to transform the lives of all of our citizens. Our most valuable asset in all of our countries are our people and their health. We have no greater responsibility than to serve all of our patients. One of the challenges that we face is to ensure that all medical advances are available to all patients regardless of where they live. That has not always been true. The University of Nottingham will partner with all of our friends throughout Kenya, from Kisii to Nairobi, from north to south, so that we can share the technologies that we are developing in partnership with our partners in Kenya. What are we beginning to do? Well, Nottingham is home to the largest number of RNA therapeutic investigators, that technology that transformed our lives through the pandemic. We are now seeking to democratize the access to RNA technologies so that they will not be just available in the global north. Revolutionizing our generic, using on the long traditions of the University of Nottingham in pharmacy and pharmaceuticals. A 100-year tradition where we are making access to medicines more available throughout the world, and Kenya will be the access and the driver of change throughout Africa. I also want to acknowledge the leadership of Professor Eleanor Mitchell at the University of Nottingham, who is working with maternal and pediatric clinics across Kenya, every clinic that's available, with an MRC-funded clinical trial that will transform the survival of newborn babies. Is there a more worthy work better to share educational advances so that we learn from Kenyan experts, so that we are better prepared in the UK with the knowledge that you can impart to us? I also want to share some good news and acknowledge the support of Cancer Research UK. One of the greatest injustices is that, depending on your ancestry, you will be diagnosed earlier, you will respond more poorly to medicines, depending on your ancestry to certain cancer types. Cancer Research UK is investing $25 million to address that inequity in cancer outcome. This is a partnership led by colleagues in the United States, but co-led by Dr. Sheba Ershad from King's College London and myself in the University of Nottingham. In this ambitious program, we are working with oncologists and pathologists across Kenya, from north to south, from Kisii to Nairobi, where we are going to recruit thousands of breast, prostate, and pancreatic cancer patients. We're going to reverse the historic lack of knowledge about cancer in patients outside of Europe and North America. That knowledge is going to equip us to develop the new therapeutics, the new diagnostics that will transform lives and extend duration and quality of lives. As we look to the future, the global burden of cancer is going to shift from north to south. This work is urgent and is only possible because of the partnerships that had existed between the UK and Kenya. So, Mr. President, I want to conclude by thanking you. Your presence here is a strong signal for the support for the UK-Kenya Health Alliance. Your support is pivotal and will motivate us to continue our work. I'm very thankful.
Thank you, Professor Momon. And on that note, I do invite the Vice-Chancellor of the Liverpool School of Tropical Medicine, Professor David Lalo, with whom we are working on a technology to support BioVacs get to their first vial by 2027. Thank you, Your Excellency.
Thank you, and it's a real pleasure to be here. And Your Excellency, thank you very much for being here and gracing us all with your presence. LSTM is an unusual organisation in that we focus almost exclusively on improving health outcomes in disadvantaged populations globally. And almost 95% of our work is actually undertaken in low and middle income countries. We've had a very long association with Kenya. The first project that I could find that occurred in Kenya was over 100 years ago. And so this is something that's really close to our heart. And of course, if we're going to achieve that increase or improvement in health outcomes, that can only be done in partnership, as others have indicated. And Kenya, for us, is one of the most important partnerships that we have. We've had a major partner with KEMRI in Kisumu, in the west of Kenya, for over 20 years now. That partnership has actually made enormous advances and impact on the management of malaria, from the first bed net studies to the understanding how you treat malaria in pregnancy to actually implementing the vaccine. And out of that partnership, I think, has been a real step forward in how we manage malaria around the world. And the impact of the research done in Kenya is actually global. The other side of that, I think, is the really critical issue of how scientific capacity is strengthened and developed further. I first visited Kenya, actually the KEMRI unit on the coast, in 1989, and to have witnessed the explosion in scientific talent in Kenya over what's now quite a long time has been absolutely fantastic. And we in LSTM are really committed to continuing to support that scientific talent in the best way, both through education and through collaborative research. More recently, we've had a focus on snakebite. In the last 10 years, we've been coordinating and collaborating with KIPRI. We've supported the development of snakebite research in Kenya. We've supported the development of a herpetarium where you can now actually manage snakes and extract venom for use in your own products to treat snakebite. And I recognise that snakes are not always a topic that's popular for many Africans. And to see the response of people as they go around the herpetarium in KIPRI has been quite fun. But it is a really important issue. And it's led to our most recent partnership, which is now about a year old, directly with the Ministry of Health, to look to see how LSTM can support the development of your own antivenom capacity, so that Kenya can develop antivenoms and not be dependent on imported antivenoms. We've been very privileged to actually welcome both of your PSs to Liverpool over the last year, in fact. And your current PS actually got news of his promotion while he was sitting in our boardroom. So I hope that association will continue. But I think the importance of helping and support Kenyans' capacity to develop their own products is absolutely critical, which has led to the third, more recent, again, collaboration that we've had a great time discussing earlier this morning with the Ministry of Health. And that's a program that's called the BRIGHT, which is essentially about how Kenya can develop its own systematic biological innovation system, how we can move to small-scale manufacturing of monoclonals, of vaccines, of antibodies for infection and for cancer. I guess how to help Kenya to promote its own economic resilience, so it's not dependent on imports and actually develops its own health sovereignty. And that program, we're signing the MOU today. We hope to start that next week, and we have been told very clearly about the importance of urgency here in our discussions earlier this morning. And I think that genuinely will make a big difference to what Kenya can do as a nation in driving down the cost of products and improving the care to its population. We've heard already, I think, about the importance of education, but in LSTM we're thinking very carefully about what are the new models that you need for health personnel. The model of taking people out of healthcare and training them for a week is not acceptable anymore. We need to think about how we can train clinical staff of all cadres in service, how we get the right courses for those individuals, and I think also how we can train the next generation of clinical academics, clinical academia, people that are both clinicians and researchers is in a crisis at the moment, and that crisis occurs all over the world. And I think we've had some very interesting discussions again this morning about how we might facilitate clinical academic training. I'll finish also by saying that partnerships are not one way, and this is very much as a two-way partnership. We've had a reasonably long-standing now relationship with community health teams in Homa Bay, and exchanges by which in the UK we
to sort out some of these matters. And there was a small pitch, if you like, on the investment trap. So without further ado, I take this opportunity to welcome you all. And as protocol calls and requires, let's be upstanding to receive the national anthem of Kenya, East Africa, and of course, the United Kingdom, where our partners are for. Kindly, Sam.
Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuwajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano iwe msingi wa umoja wetu, na tulinde uhuru na amani. yetu na desturi zetu. Jumuiya yetu sote tuilinde, tuwajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Viwandani na hata mashambani, tufanye kazi sote kwa makini, tujitoe kwa hali na mali, tuijenge jumuiya bora. Jumuiya yetu sote tuilinde, tuwajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Thank you very much.
Transform
Thank
your
you.
guest wife.
Kindly be upstanding for the opening prayer. As we agreed yesterday, we're a blessed nation. We love our prayers. Can I call on Dr. Emily Basito, the Deputy Director of the National Cancer Institute, to lead us in prayer this morning? Thank you.
Thank you so much. Let's pray. Indeed, Father, we come before you this morning. We worship you and we thank you. We thank you for the gift of life and good health. And we thank you, God, for the opportunity that you've given us, oh God, our two nations, Kenya and United Kingdom, to be here together and to partner, oh God, in the endeavor of uplifting the healthcare of our nation. Father, we thank you. Thank you for these opportunities for partnerships. And Lord, even as we start the day, we commit ourselves before you, that you will go ahead of us, that you will keep us safe, you will keep us in good health, that Jehovah will be able to achieve that which has brought us here. Therefore, Lord, we thank you. Thank you for our nation. Thank you, Father, for United Kingdom. Thank you, God, for you have brought us together for great, great endeavors. And Jehovah, we bless you and we worship you. In Jesus' name we pray.
Thank you very much. So my role as the MC has now come to a point where I hand over the microphone to the voice of officialdom, the people who speak from the corridors of power. The people have the mandate to make KUKA move forward within the bosom of the Kenyan and the United Kingdom government. Can I give Dr. Omar the opportunity to come and take the floor? Thank you. Welcome, please. A round of applause for Dr. Omar.
Thank you very much for that opening session. My name is Omar from the Ministry of Health. I'm Director, Health Sector Coordination and Health Diplomacy. First, let me acknowledge my seniors who are here and our guests, led by PS Mary Modoni, Permanent Secretary, Principal Secretary, Public Health and Professional Standards. We have also Dr. Beatrice Muganda Inyangala, Principal Secretary, Higher Education and Research, His Excellency Matt Hag, British High Commissioner to Kenya, invited guests, ladies and gentlemen. Gentlemen, good morning. I wish to welcome you to this short official opening. We have technical presentations, short technical presentations, keynote speech, and then we have speech from our invited guests who are here, the guest of honors. And then we also have two important guests who will join us by video, recorded video, actually. We have Professor Shaukat, PS Research, who will join us by video. And also, I'm told also, we have another video from the leadership of our country, His Excellency the President, Dr. William Ruto, will also have a video that has recorded a video for us. So I will lead the first opening part, which is on the technical session and the partnership session. We have three speakers for this session. We have Richard Cohen, we have Mahesh, and then we have also keynote speech by Professor Graham Lord. So let me take this opportunity to welcome Richard Cohen to make his remarks. Is Richard here? If not, then we can continue with the next presenter. We have Mahesh. Please welcome.
Chair, distinguished guests, ladies and gentlemen, all protocols observed. I'm not used to speaking in such fora. This journey started about 5 years ago under the leadership of my former dean, Professor Graham Lord, and we had this opportunity to come and present a dream, really. You know, for dreams to come true, you first need a dream. So we came with a dream, and the dream that we had from Manchester at the time was to create a hub and spoke model for cancer care in Kenya. A center of excellence would be the hub, and from where the spokes would deliver excellent cancer care. And a center for health education and training based in the Lakes region. The purpose was twofold. One was to create the workforce that you need to deliver based on a modernized curriculum, modernized pedagogy, rather than the old school form in which medicine was being taught in the entire former British colonies. So we had that. And then in addition, can this hub, teaching hub, also draw in premium fee-paying students who would contribute to the economic activities of the Lakes region? After all, about 34 billion pounds is what Britain gets in terms of net income with overseas students. As situation in the world changes, is there an opportunity for this center of excellence based in the Lakes region to share that dividends? That was essentially the vision. And under that vision, the last 5 years has reached some significant successes, which I'm sure you all have heard yesterday, the cancer program being an example. Some really good public health surveys have been done. But to take this to the next step, I think this vision that we presented has been acknowledged, and there is a cabinet paper which is read out, which is a memorandum which has been acknowledged. So 2 consecutive administrations have seen the value of that vision. So what I would humbly request from this panel, I'm glad that the British High Commissioner is here, I'm glad that the peer, is we need to put some structure around it, some meaty structure around it, so that it doesn't remain a dream that went unfulfilled. And with that request, I think I will call it a day. Thank you very, very much, and I will be failing in my duties if I do not acknowledge the role John is performing almost through his passion to Kenya. There's nothing more that he gets, and that needs to be acknowledged, recognized, and a structure put in around him so that that vision can be carried forward with the energy that it needs. Thank you very much indeed.
Thank you very much, Mahesh, and for challenging us to move the vision towards a sustainable structure that we can build on. As has been mentioned, this is the fourth, I think, conference. So, and you've said that it has, passed over two governments here in Kenya, and I believe also in the UK. So, it means that there's goodwill on both sides to continue with this partnership. I would now like to take this opportunity to welcome Professor Darren Walters to make his remarks. Is Professor Darren Walters here? Okay, thank you.
Ladies and gentlemen, distinguished guests, thank you for the opportunity. I had 30 seconds warning that I was to step in and say a few words, so forgive me if they're a little disorganized. I have been connected with Kenya for 4 to 5 years, so I'm a relative latecomer to this collection of partnerships. I was brought on board because of my interest in trying to develop emergency care, and it has been remarkable how synergistic our collective views are to improving the care of the people that we serve. My engagement, my focus currently is largely in Kisii. It's because His Excellency the Governor of Kisii said, "Come here, you help me deliver for my people." And I thanked him for that, and each time I see him, I remind him that's what he told me to do, and he encourages me further. Everybody I have engaged with has been fully supportive. There is a real momentum building. We need to share. This is far too big an issue, far too big a challenge for one group, one specialty to deal with. This requires the full health system. We're hearing about cancer, we're hearing about kidney disease. As an emergency physician, I declare a conflict, but I argue emergency care is really important. But all these are moving forward, and they are all moving forward under the Kenya-UK Health Alliance. The KUKA Alliance is the glue that's holding all these parts of the system together. And I am grateful for the opportunity to come here and recognise that, to thank them, and particularly John for their support as we move this forward. And I look forward to hearing from our seniors today where they see the journey for Kenya going, and working out how we can try integrate with that and support them in their journey. Ladies and gentlemen, thank you for your time, and I hand back to the MC.
Thank you very much, Prof. Darren Walters has put a case for inclusion of the sub-theme of emergency care, and I think we can consider that in the next 5th conference. Before we came here, I think His Excellency the Ambassador and our PSS were also discussing pandemic preparedness. I know it's somewhere here, it's hidden here, but I think maybe we can have it now standing out going forward, because it's a bigger challenge that is currently ongoing globally. So with that, I would like now to take this opportunity to invite our keynote speaker, Professor Graham Lord from King's College, London, to make his keynote address. Welcome, Prof.
Caribou. Good morning. We can do better than that. Good morning. Thank you. Your Excellency, PS, honoured guests, friends, all protocols observed. Mahesh mentioned that 5 years ago we had a dream
of an alliance between our two countries. So I'll just talk very briefly about the last 5 years and what we turned that dream into. I think we stand here today, and then before we all leave, when the conference finishes on Friday, we stand at an inflection point about what we do in the next 5 years. And we should not leave here on Friday without a clear action plan for how we build on the momentum of what we've done over the last 5 years. KUKA, the Kenya-UK Health Alliance, is an interesting phrase. I'm not going to give a lecture about semantics, but what is an alliance? What is a partnership? What is a structure for moving forward? It's quite important to understand how we got here. I think what KUKA stands for and what the foundations that we've laid down are trust, friendships, a shared vision that has passed across administrations, both at national level and at county level. So I think we think the vision is robust. But having laid the foundations, we now need to build the house, because at the moment there's not much to see. But that's always the case. You build the foundations and you see nothing, and then you're amazed when the house goes up and you say, that's a beautiful house. And the point being is if you haven't got the foundations, you can build the house and then in 5 years' time it falls over. So this is a 25-year, 30-year vision, and we're 5 years into that. Rome wasn't built in a day. Kenya-UK Health Alliance won't be built in a day, but we've made a very good start. The context, for those of you, some of you may remember this, but it was linked to the UK-Kenya strategic framework that was signed in 2020 to 2025 by Prime Minister Johnson and His Excellency, your former President, Uhuru Kenyatta. And following on from that, KUKA was founded almost 5 years ago. I'll come back to the 5th year anniversary in a minute. In July 2021, we signed the partnership in the presence of your former President and our Prime Minister. The future is that the UK-Kenya strategic framework was renewed from 2025 to 2030 by His Excellency Dr. William Samuel Ruto and Prime Minister Keir Starmer until 2030. So that will be the context for the next 5 years. And the vision that the heads of our governments and all of us in this room share is universal health coverage, which was in the former administration one of the big four, as you will all remember, and has been preserved and built on in this administration. And we have to ask ourselves why that is. It's because this is not a political choice. This is what all governments and people do for their populations in providing healthcare that everyone can access. It's not in the UK, it's not a left or a right, it's not a whatever party you're in. This is a fundamental human right for everyone in Kenya and the UK. And I look at this, why do we need two countries to do this together? We're trying to address our key question is how do you provide a healthcare system that is sustainable in terms of money, in terms of workforce, and in terms of the environment? How do we make sure that it's of high quality? People deserve the best treatment available, whatever they are in the world. Now that's a bold dream and a bold vision, but we should never resolve from that as our aim, because just trying to get there will make massive improvements. You can shoot for the stars, but you'll land on the moon. So let's have a very bold vision about the quality of healthcare we provide in a sustainable manner. And then we need to do that for all of our people. So we need universal access. If people are locked out of basic health and care, we have fundamental challenges in our society. We need to look at access to healthcare as a security issue, and I know the government of Kenya and the county governors do, and I know that the UK government does that as well. So what have we done over the last 5 years that gives us confidence to build on for the next 5 years? We work very, very closely with the Kenyatta University Research, Teaching and Referral Hospital and partnered to build a molecular imaging centre.
to build a cyber knife, and also to run a fantastic program for it. So George Ungarogi, as the principal investigator from Kenya, led a fantastic study about the prevention and treatment of esophageal cancer. That, as he was telling us yesterday, diagnosis is death, because when people present, it's at stage 4, and the mortality is about 99.3%. Did I get that right, George? 99.3%. So clearly, how do we work with our community teams to diagnose the disease at an early stage, and also to understand the genomics and the etiology of that disease so it can prevent it happening in the first place? And that was because that was driven by the needs of the population in Kenya, not what we in the UK thought was important. And that's a very important principle that in this alliance, Kenya leads, and we will support where we can, and we will walk alongside you in the spirit of friendship and true partnership. And so I think the cancer, and why did we choose cancer? There was a WHO report in 2020 showing that the rising burden of non-communicable diseases by 2030 will have a disproportionate effect in low and middle income countries. And also the economic consequences of that are absolutely profound with NCDs. And also that there would be a failure of workforce. 80% of the workforce gaps by 2030 will also be in low and middle income countries. So the second part of our first 5-year dream was, how do we upskill healthcare, education and training? And we heard yesterday about the cabinet memo in 2023 that your current president put to bear about how do we upskill the workforce for the future. Again, one of my 3 components of building a sustainable healthcare system. How do we work on that training piece? And that is a part of the first 5-year dream that is yet unfulfilled, that we carry with us into the next 5 years. So in terms of the next 5 years, what's the basis for the starting? So following the 2025 to 2030 UK-Kenyan partnership, His Excellency President Ruto visited myself and our UK partners at King's College London in the Strand, and King's College London, who's my main employer, signed an addendum to the KUKA MOU for King's to join Kenya-UK Health Alliance, to join this great list of partners that you see on the poster here. There we go, here. So what started out between Manchester and the Kenyan government is now genuinely expanding to include the whole of the UK. And one of my jobs back in the UK is to make sure we bring everything to bear, from public sector, private sector, and the NHS in the UK to bear to this alliance. There's a huge power to that, as I know is happening on the Kenyan side. And together, those two pillars of the partnership really can move the world. So what do we do in the next 5 years? What are the plans for the next 5 years that we were discussing yesterday? And we will come to a declaration before we leave on Friday. The first thing is, let's not forget what we have achieved in the last 5 years in a spirit of alliance. We've done great work in cancer. You've heard about that. And actually, we did it in a financially sustainable way, because we prevented people leaving the country for treatment to people not only staying in the country, but actually people coming in from other countries around the world. So actually, we upskilled the cancer centre in a way that generated investment that could be reinvested, back to my first principle of sustainability. So actually, as long as we do this with a business model that's sustainable in and of itself, then when we ask for funding to come in from outside, we can assure those funders that the house won't fall down in 5 years' time. So how do we build on cancer? And we had a very good session yesterday with Professor Elias Melly from the National Cancer Institute about who has a mandate for taking best practice that we're starting to demonstrate and spreading it out across the whole of Kenya. And there is a number of very good plans about how we're going to do that. So working very closely with NCI is how we scale what we've done over the last 5 years into the next 5 years. The second thing the Kenyan government asked for support with is IAKI, East African Kidney Institute, that is here in Nairobi, but the African Union and the African Development Bank has said it's not just for the people of Kenya, it's for the people of East Africa. So it's great to hear the East African anthem at the beginning So what we do in Kenya with support of KUKA benefits all of the people in East Africa. Kidney disease, the WHO last year accepted it onto their list of critical non-communicable diseases. On this continent, there are approximately 350 million people with chronic kidney disease, mostly undiagnosed. So what will happen is we're not going to be able to give dialysis or transplantation to 350 million people if they progress. So we have to diagnose and treat it early. We know how to do that. It's just how do we implement that? We have very, very cheap treatments to prevent the progression of chronic kidney disease to the requirement for dialysis and transplantation, and how we're going to be mindful across the whole of East Africa, starting with IACI, to bring that prevention and early diagnosis and treatment to the population of Kenya, but to the population of the whole of East Africa. So that's a challenging mission, an ambitious mission. And then for the hopefully the smaller number of people that do then need dialysis and transplantation, how do we ensure that IACI is able to deliver the highest quality outcomes for dialysis and kidney transplantation? And my hospitals in the UK represent some of the best nephrology and transplantation practices in the world. How do we partner with you to upskill your workforce to deliver that here in Nairobi? So that's the second piece, kidney disease, as part of our NCD programs. And the third piece that underpins all of this, as I said, is people, workforce, training, quality control. And we propose for the next 5 years to have a significant emphasis on systems leadership in healthcare. King's College London, in partnership with the University of Nairobi, has an African Leadership Centre about 2 miles from here. We've had that since 2010, and it's leveraged in over £25 million of philanthropic and government funding. And what we've agreed to do, and we agreed to do it at the MOU where your president was present, is that we're going to extend a third arm of that African leadership into healthcare systems leadership. And we want to work with the Kenyan government, the British government, with philanthropists, with banks and other funders. So how do we do this at scale? So it's not just here's 5 fellowships. How do we do 500 over the next 5 years? How do we make it affordable with bursaries so that it's not just the people that can pay get that? And how do we ensure that then the people go and get training in the areas that we've prioritised through KUKA and then come back to Kenya? And so the Kenyan government and population benefits, as does the whole of the population of East Africa. Again, it's a very bold vision, but actually we now need to move to that very, very rapidly. So 3 areas: extending the cancer programs we have to the whole of Kenya, establishing IACI for Kenya and East Africa, and underpinning that with workforce and leadership programs. So my final closing comments, when I was just jotting something down, partnerships for sustainability. We've talked a lot about sustainability. And what does that mean? It means we need an action plan that we're all here to discuss and align on. And actually, the last day and a bit, we've shown actually there is complete alignment about what we want to do. We're not, where there's discussion, it's at the margins, not about the centrality of what we're trying to do. Because this is a build on 5 years. This is not a new conversation. We talked about this 5 years ago. We've progressed through. Now what do we do for the next 5 years? And essentially, the action plan is 90% written. We'll finish it off before we leave here. We then need to align the 2 governments in terms of, does this fit within the UK-Kenya strategic framework? We would all argue that it does. So we then need to align funding for sustainability from both governments. We need to engage philanthropy, whether that's through the diaspora that we were talking about yesterday, or other funders. African Union Bank, the Wellcome Trust, who are already investing a huge amount in Kemri, I know that, which is a fantastic opportunity, and the World Bank, the Gates Foundation. So how do we align philanthropists? And then critically, how do we align the private sector? Where does the private sector play into this? There's massive benefits in the private sector. We talked about local manufacturing yesterday, bringing jobs, bringing in healthcare tourism, bringing in educational funding that Mahesh talked about. There's a very good opportunity here for the private sector to benefit in terms of generating value for their shareholders, but you need to invest to get a return. people in the private sector understand that. You don't get a return without investment. So how do we align that investment? Whether it's through the different foundations of the banks that want to provide bursaries for fellowships to upskill our healthcare workforce for the future. So really that's the challenge. The 5th anniversary of KUKA is the 27th and the 28th of July. We're hosting that anniversary and the AGM of KUKA at King's College London, in the centre of London. I would like to extend to all of you an invitation to come along to that, where we aim to unveil the plan, the funding for the plan. So we've got about 6 weeks, John, to raise a bunch of money. So it's nothing like a bit of time pressure. But that's the plan. We come out of here with a plan, then we raise the funding to deliver it. And so that when we come back in 10 years' time to say, what are we going to do for the next 5 years? We'll say, we built on the foundations, here's the house, here's how we turn the house into a palace for all of our people in terms of a sustainable healthcare system. And I think that is a legacy we would all be very proud of, but that action starts today. I'll stop there. Thank you very much. Asante Sana.
Thank you very much, Prof. I think Prof took us through the 5-year journey of where we started and the vision, our vision for the next 5 years. I picked the 3 key areas, which is, expanding cancer care, prevention, also the East African Kidney Institute as one of the anchors to benefit. And Prof mentioned rightly that this institute will not only benefit Kenya, but regionally. And Prof also being a regional hub for healthcare. Even the cancer intervention, I think will benefit our neighbors. And this is evident from, if you visit hospital, you see a good number of our patients coming from neighboring countries. We have also a health tourism strategy that we are trying to position the country as a hub, regional hub for health tourism, inward bound, of course. And I think lastly, Prof, you mentioned on the system leadership, and I think this is a very important intervention. I think combining it also with strengthened governance to help institutions ensure sustainable changes and visionary leadership to take the journey forward. So before I invite my peers to take us through the VIP session, let me take this opportunity to acknowledge the partners, the members who are here, the institutions. I will acknowledge a few, and if I don't mention yours by name, please know that you're also acknowledged in principle. I want to start by our universities. We have Masinde Muliro University here, Professor Subairo, welcome, the Vice Chancellor. We have also Egerton University represented here, representative of university, welcome. We have Kisii University, I think it has been mentioned by Darren. Is a representative of Kisii University here? I'm told, okay, they are represented. University of Nairobi, I'm seeing a familiar face. Is it University of Nairobi or in another capacity, Professor? Okay, but also University of Nairobi. Thank you. We also have some of our institutes. We have the National Cancer Institute, which has been mentioned. It's represented here. Welcome to the team from the Cancer Institute. We also have our premier hospital in Kenya, public hospital, which is the Kenyatta National Hospital. Do you have Kenyatta National Hospital here? Oh, I think Kenyatta Hospital and University of Nairobi have a very unique relationship. So forgive me for sometimes confusing a professor of the hospital being a professor of the university. But I think Prof. Lydia, welcome. With that, I would now like to take this opportunity to invite my Principal Secretary from the Ministry of Health, State Department for public health and professional standards to take us through the VIP session. We have one video session and other physical sessions. Welcome, madam.
A round of applause for your MC for the day. Your Excellency Matt Bo, British High Commissioner to Kenya, Professor Graham Lord, I think we might fire you. My colleague, Principal Secretary, Dr. Inyangala, the PS for Higher Education. Allow me to ride on the protocols that have already been established so that I do not mess. Ladies and gentlemen, good morning. Good morning. I know it felt a little cold in the morning. We are moving into winter in Nairobi. So June, July is a very, very cold month in Nairobi. But we survive. Not as cold as sometimes London in the UK. Not that cold. But we always feel like it's too cold. So this is the time to buy boots, sweaters, jackets. Other than that, it is my distinct honor to welcome each one of you. For those who are new to this country, welcome to Nairobi. And Nairobi is the only city in the world where you can find a game park in the city. And that gives you a very good reason to finish your work early, because there's something that you can do after 4 p.m. So I will urge the organizer of this meeting to make sure that our visitors have visited the Nairobi Game Park and ensure that we see the animals. It's only that they are not tamed. So careful. Ladies and gentlemen, as we gather here today under a timely and ambitious theme, from challenges to global solutions together, building Kenya and Africa's health innovation future. This gathering represents a very vital convergence of minds and dedicated to shaping the resilience of the health architecture that serves not just our nations, but also the continent at large. As we navigate the transition, especially in our country, to the Social Health Authority and the rapid advance, the Taifa Care program. In our country, we are in the process of rolling out a very, very robust program of the universal health coverage. And when this government came to place, the first thing we did was to lay the base, the anchor in healthcare. And we came up with 4 laws. One was the Primary Healthcare Act of 2023 that up to date recognizes our community health promoters. We have 831 community health promoters, and each one of them has been assigned 100 households. And their work is very basic. Just move from door to door, check blood pressure, blood sugar, of course, assess the young ones, issues to do with malnutrition, ensure they remind pregnant women to go for their antenatal and postnatal. So very basic. The second act is the Digital Health Act of 2023. Indeed, everything in our hospitals is digitized. from when you get to the triage to when you get your medicine dispensed. And we have been able to also digitize our healthcare data of human resources, so that at a click of the button, we can know how many doctors are in the country, which doctor is treating who in which hospital, because they are also coded. Other than that, we also have the Facility Improvement Financing Act of 2023. Again, ensuring that we are ring-fencing all the funds that are meant for healthcare. None of the monies or grants that is meant for health is going to be reallocated to do any other work in the country. If it is meant for health, it is for health, for infrastructure, for commodities, for equipment, for acquiring new healthcare workforce. And finally, we have the Social Health Insurance Financing Act of 2023. Initially, we used to have only 20% of our population accessing insurance in this country. And that was a very small population because most of them were the employed, which basically your employer deducts the money. But right now, we are mobilizing each and every Kenyan to ensure that they access the available, affordable, acceptable, and accessible quality healthcare. Our social health authority, again, has 3 funds. And one of the funds is the Primary Healthcare Fund, which allows every Kenyan only to register and access any type of service that is offered at the primary healthcare facilities. Then we have the Social Health Insurance Fund, which is our contribution. I contribute 2.75 of my salary and anybody else. And for those who are in the informal sector, then we do a means testing to see how much you're supposed to contribute. And the third fund is the emergency, chronic, and critical illness. So that should you deplete your social health insurance, then we can plow into the critical illness fund or emergency. If you have an emergency, the mode of transport in our country mostly is through bikes, and especially in the villages. So sometimes there could be a bit of accidents happening, and many a times people would go back to their pockets to access healthcare. That is why we came up with the Emergency, Chronic, and Critical Illness Fund. So really, as a country, we are set. And as we are talking, because we realized we also left a very important and critical factor, which is the patient. So we have a bill that is before Parliament of patient safety, the patient safety bill, which is now before Parliament. And I'm sure with those 5 laws, we can only aim for the stars and ensure that everybody accesses quality healthcare in this country. Therefore, ladies and gentlemen, our core mandate remains the delivery of equitable, high-quality healthcare to every citizen in this country. And to achieve UHC, we must confront the realities of our shifting disease pattern, particularly the rapid rise of cancer, kidney disease, alongside the escalating threats to health security, such as antimicrobial resistance. And addressing these challenges really requires a paradigm shift, because we must ensure that our most vulnerable populations are protected, anchoring initiatives like the Every Woman, Every Newborn, Everywhere framework within a robust, modernized health system. Innovation and medical technology, again, are no longer optional, because they are the bedrock of effective patient care and sustainable health delivery. Furthermore, our approach to health security, again, must be comprehensive and predictive. The undeniable link between climate change, environmental health, and human well-being demands a rigorous One Health approach as well, and we build regional resilience against emerging threats like mpox, Ebola, dengue, and cholera. And by the way, you're safe. You are very safe in Kenya. We have put all measures to ensure that we protect the citizens and in collaboration equally with our neighbors. So keep calm. So threats like Ebola, mpox, dengue, and cholera, and the integration of digital health innovations, including AI-driven public health intelligence and modernized disease surveillance networks, will be very critical to our emergency preparedness. We must also champion local manufacturing, and I'm happy with the presenter who talked about manufacturing of medicine and market shaping initiatives. You see, during COVID, it was not a very good time when you could have the money, but you could not access commodities. Because where we get the commodities from, they had ring-fenced it for their population. So really, local manufacturing is the way to go. By transforming concepts into commercialized, locally produced solutions, we are not only secure our health supply chains, but also stimulate our economy. The KUKA partnership stands as a very powerful model for global health cooperation. And over the next few days that we are going to be here, of course, starting from yesterday, as we engage in these critical dialogues on genomics, clinical trials, and healthcare infrastructure, I want to challenge us all to look beyond the discussions and make sure that we forge to tangible deals, structured investments, and clear mechanisms for accountability that will drive Kenya's healthcare into a revolution forward. And with those few remarks, ladies and gentlemen, I want to request for the video of my colleague, the PS for research. My friend, are you ready?
Distinguished delegates, ladies and gentlemen, very privileged to join you today, the fourth Kenya United Kingdom Health Alliance, One Health Research and Innovation Conference. I thank the organizers for bringing together researchers, policymakers, innovators, healthcare, development partners, and industry leaders to deliberate on one of the most pressing challenges of our time: how to build a healthier, more resilient, and innovative-driven future for Kenya, Africa, and indeed the world. The theme of this conference, From Challenges to Global Solutions, together building Kenya and Africa health innovative future, reminds us that the complex health challenges we face today demand collaborative, science-based, innovation-driven response that transcend institutional, disciplinary, and national boundaries. Science, research, and innovation are no longer peripheral activities confined to laboratories and universities. They are now central pillars of economic transformation, national competitiveness, public health resilience, and sustainable development. Health innovation represents one of the most critical frontiers where science can directly transform society, from vaccines and diagnostics to digital health technologies, precision medicine, artificial intelligence, biotechnology, innovation, shaping how we prevent, detect, and manage diseases. For Kenya, investing in health research and innovation is not merely a health sector priority, it is a national development imperative. Indeed, the health of our people is the foundation upon which economic growth, productivity, and social prosperity are built. Distinguished participants, ladies and gentlemen, cancer is one of the leading causes of morbidity and mortality globally and within our region. Today, for example, in Kenya, cancer remains one of the Kenyans' most pressing public health challenges, with nearly 47,000 new cases and more than 32,000 deaths reported every year. Science and innovation provide a powerful tool for changing this trajectory. We must continue supporting research in areas such as genomics, molecular diagnostic, precision medicine, medical imaging, data analytics, and cancer surveillance system. Equally, we must importantly develop local available solutions that respond to the unique genetic, environmental, and social economic context of the population. Kenyan universities, research institutions, innovation hubs possess enormous potential to contribute to breakthroughs in cancer prevention, diagnosis, and treatment. What is now required is a stronger collaboration between the researchers, clinicians, policymakers, the industry to accelerate the translation of research findings into accessible healthcare solutions. Ladies and gentlemen, kidney disease are increasingly becoming a significant public health concern in Kenya and across Africa. The rising incidences of hypertension, diabetes, lifestyle-related conditions have contributed to growing cases of chronic kidney diseases. The cost associated with dialysis and transplantation continue to place immense pressure on health systems and households alike. Digital health platforms, predictive analytics, and artificial intelligence offer promising opportunities for identifying at-risk population and enabling timely intervention before the disease progression occurs. As a country, we must therefore strengthen investment in health research, infrastructure, and support multidisciplinary research teams capable of generating practical solutions to these emerging challenges. We are committed as a government to move from the current 0.78% of the GDP to 1% of the GDP in research and development ecosystem. The recent global experiences have demonstrated that health security is inseparable from the national and economic stability. Today, antimicrobial resistance, zoonotic diseases, climate-related risk, and emerging pathogens pose significant threats to global health security. The complexity of this challenge underscores the importance of One Health approach. One Health recognizes the interconnectedness of human health, animal health, environmental health. It calls for an integrated solution that brings together expertise from medicine, veterinary sciences, agriculture, environmental management, biotechnology, and public health. The State Department for Science, Research, and Innovation strongly supports the interdisciplinary and transdisciplinary research that advances One Health agenda. Kenya has made significant progress in building a vibrant research and innovation ecosystem. We are home to international recognized universities, research institutions, innovation hubs, technology enterprises. Our scientists continue to contribute to global knowledge across multidisciplinary areas. The government remains committed to fostering and enabling an environment for scientific research and innovation through supportive policies, strategic investment, and institutional reforms. In this regard, we are promoting a stronger linkages between the academia, the government, industry, and developing partners to ensure that research outputs are translated into products, services, and policies that create tangible societal impact. We are also championing commercialization of research outputs, protection of intellectual property, and growth of innovative, driven enterprises capable of contributing to national development. Our vision is to build a robust innovation ecosystem where scientific discoveries move efficiently from the laboratories to the market and ultimately to the community. Ladies and gentlemen, the future of Kenya Health Innovation Agenda ultimately depends on our people. We must invest in nurturing the next generation of scientists, researchers, innovators, and entrepreneurs. By empowering our youth, we are investing in the long-term sustainability of our health innovation ecosystem. The Kenya-UK partnership represents an excellent example of how the international collaboration can accelerate scientific advancements and innovation. Through collaborative research program, capacity building initiatives, technology transfer arrangement, and institutional partnership, our two countries have generated valuable knowledge and strengthened research capabilities. Together, we can transform scientific knowledge into solutions, challenges into opportunities, and partnerships into lasting impact. Together, we can build a healthier, a more resilient, and a more prosperous Kenya and the world at large. I thank you for your attention.
I'll wait until you pronounce the second one. Yeah. Please, welcome.
Friends, good morning. Before I begin, PSs, two quick declarations from me. As High Commissioner, I get to give quite a lot of speeches. I don't often get to give quite so many speeches in front of quite so many doctors, and apologies for what I'm about to say. 3 years ago, my sister-in-law was diagnosed with a quite particular and quite rare form of cancer. She was in the UK. She was lucky enough to find herself placed onto a groundbreaking, first of its kind trial as an inpatient. That hospital was the Christie. Sorry. I am delighted to tell you that today she is fit and well. I say this partly to say thank you to the Christie. I don't often get the chance in such esteemed company. But also to say this, that that trial would not have been possible without collaboration, without connection, and without community. And that's what I see here. Because this community for patients also provides two immutable things: progress and hope. So from my family to yours at the Christie, to this community, thank you. The second declaration is that I'm the son of a now retired physician. I'm the brother of a medical researcher, and I'm the husband of a practicing medic. So I'm feeling quite a lot of familial expectation on what I'm about to say next, in terms of not to mess it up. Your Excellencies, dear PSs, two of the busiest women I know, thank you for sharing your time with us this morning. Distinguished guests, ladies and gentlemen, it is a great honour to be here today for the opening of the Kenya-UK Health Alliance Conference and to mark its 5th anniversary. I want to thank all of the UK delegation and all of our many splendid Kenyan partners for the collaboration that has brought us to this point. The Alliance is a flagship of cooperation and of shared purpose. And as we've heard already from Mahesh and from Graham, 5 years ago, this alliance was an idea. It was a dream. Today, it is an idea that already connects governments, universities, clinicians, researchers, investors, and businesses across continents. That alone is worth celebrating. But anniversaries matter more if they propel us forward. So today, if you'll indulge me, I want to focus on where we might go next. Kenya and the UK have complementary strengths, shared interests, and a strategic partnership that sets the highest of expectations and demands results. Our task this week, therefore, is not to discuss cooperation, but to find ways of delivering it. To translate the ambition that is present in this room into investable projects, bankable opportunities, and as the PS has said, tangible outcomes for citizens and patients in both our countries. The case for that ambition is clear. Health is not a cost. It is a right. It is also our shared security. Strong health systems also drive productivity, build skilled workforces, attract investment, and underpin successful economies and safe countries. Every shilling, every pound invested in health infrastructure, every citizen trained as a clinician, researcher, or manufacturing specialist, every internationally accredited facility built, these are not just health outcomes. They are social and economic and public assets. Kenya understands this. Its ambition for universal health coverage, local pharmaceutical manufacturing, and health innovation is not just a health strategy, it is an economic and security strategy. And the UK wants to be Kenya's partner in delivering that strategy. So what does the UK bring? I feel slightly churlish in setting this out, given who's in this room. Of course, it's the NHS, one of the world's largest excuse me, and most experienced health systems, with deep expertise in system design, clinical governance, workforce development, and patient safety. World-class teaching hospitals, including King's College, Guy's and Tommy's, the University of Manchester, and of course the Christie NHS Foundation Trust, among many others. And world-class research on everything from tropical disease to assistive technology, from the London and Liverpool schools and across our UK educational establishments and universities. The partnership between the Wellcome Trust, the University of Oxford, and Kenya's Medical Research Institute that goes back over 60 years. It jointly runs one of the most advanced medical research labs in Africa, and last year announced new investment into Kenya of 15 billion shillings. The UK's life sciences sector is among the most innovative globally in pharma, medical devices, diagnostics, and digital health. Our regulatory expertise that can help Kenya build the internationally recognized frameworks that attract investment and protect patients. And we bring private capital that is looking at Kenya as a market of genuine opportunity. That combination, ladies and gentlemen, of clinical expertise, research excellence, regulatory credibility, and private investment is, I would argue, distinctive. And it is what the Kenya-UK Health Alliance is designed to mobilize. But we must be honest about what this moment also demands. Competition for health investment across Africa is intensifying, and the choices that Kenya makes about whom to work with and on what terms will shape its health system for decades. In that context, the UK's offer has to be concrete, capable, and able to deliver at scale. It's why we welcome the planned MOU between the East African Kidney Institute, King's College London, and Guy's and St Thomas's to be signed next month. It's why we welcome the renewed partnership between the University of Nairobi and King's College, deepening collaboration across research, clinical excellence, and training. And it's why we are encouraged by progress on the 6 centres of excellence, including, as we've heard earlier, the Kisi Centre of Excellence, a practical, visible example of what co-investment looks like on the ground. Your Excellencies, these announcements show that this health alliance can move from dialogue to deals, from partnerships on paper to investments that deliver, that train Kenyan specialists, treat Kenyan patients, and build Kenyan capability for the long term. Your Excellencies, this next phase of this alliance, our alliance, must be defined by delivery. More health workers trained to global standards, more research conducted here by Kenyan scientists with international partners, more local manufacturing, more facilities that serve Kenyan citizens and attract regional patients. As I finish, one final comment. Kenya can count on the UK as a strategic partner that is ambitious, reliable, and focused on results. I therefore hope that this conference can continue the acceleration of that delivery to connect capital with ambition, expertise with implementation, and partnership with impact. And that together we can make the next 5 years of this alliance be defined not by what we plan, but by what we deliver. Have a great conference.
Another round of applause. Indeed, SDG 17, we can only enhance that statement of partnerships. But it is not just about attending the meeting, but it is also implementing what we have discussed. At this juncture, allow me to invite my sister and my friend and my colleague, Honorable Beatrice Inyangala, the PS for Higher Education. Karibu.
Let me start by thanking my sister, PS Mary Mudhoni, very much for bringing us here together. Your Excellency, Matt Bo, the British High Commissioner to Kenya, my sister and friend, PS Mary Mudhoni, Graham Lord, King's College London, our very own Manoa Espisu, former ambassador of Kenya to the UK, the Vice Chancellor, Masinde Muliro University, Director Omar, and other staff from the Ministry of Health, staff from the Ministry of Education, and staff from the State Department for Science, Research and Innovation, all esteemed partners of the KUKA Alliance from the UK and from Kenya, invited guests, ladies and gentlemen, good morning. Good morning once more. I'm here to ably represent my Cabinet Secretary, Honorable Julius Migos Ogamba, the CS for Ministry of Education. But before I read his speech, I have a subtle reflection on the journey traveled so far. It sounded slow, sure, but slow. I believe most of you had that feeling. But let me build some context to this. Within the African culture, the word kuka in many African languages actually means grandpa. Okay? So when I look at this alliance, I see grandpa. And grandpa comes with many, many years of life. Wisdom, caring, nurturing hands. And this, ladies and gentlemen, is Kuka to us. So I'll read the speech of the Cabinet Secretary. It gives me great pleasure to join you today at the 4th Kenya United Kingdom Health Alliance, One Health Research and Innovation Conference. Allow me to begin with the words of the renowned scientist Louis Pasteur, who observed that science knows no country because knowledge belongs to humanity and is the torch which illuminates the world. Those words capture the spirit of this conference and the enduring partnership between Kenya and the United Kingdom. We meet at a time when the world continues to confront increasingly complex health challenges. Emerging diseases, antimicrobial resistance, climate change, food insecurity, environmental degradation, and growing health inequalities that remind us that health challenges do not respect borders. The solutions we seek must therefore be collaborative, multidisciplinary, and global. The theme of this year's conference, From Challenges to Global Solutions, Together, Building Kenya and Africa's Health Innovation Future, is therefore both timely and relevant. It challenges us to move beyond identifying problems and focus on building sustainable solutions driven by research, innovation, and partnerships. The Kenya-UK partnership is delivering impact through research. KUKA has emerged as one of the most impactful platforms for strengthening collaboration between universities, health institutions, researchers, and policymakers. Through this partnership, we have witnessed increased research collaboration, capacity building, staff and student exchanges, mentorship programs, and joint innovation initiatives. The most recent example is the groundbreaking collaboration between researchers from the University of Manchester and the Kenyatta University Teaching, Referral and Research Hospital, Kutri. I wish to recognize and congratulate Professor George Njoroge and the UK team for their strides in early esophageal cancer detection. Let's give them a round of applause. This innovative work on improving cancer diagnosis recently received international recognition and demonstrates what becomes possible when Kenyan and UK researchers combine expertise, resources, and shared commitment to solving real-world health challenges. We have another notable example of what drives Kenya in terms of health innovation that works for the people. For over 2 decades, the academic model providing access to healthcare, AMPATH, a partnership between Moi University, Moi Teaching and Referral Hospital, and Indiana University of the US, demonstrated how academic collaboration can transform healthcare delivery, medical education, and research in Africa. Operating across Western Kenya, AMPATH has grown into one of the continent's most successful university-led health programs, supporting a network of more than 300 health facilities that provide comprehensive care to communities at every level of the healthcare system. AMPATH has become internationally recognized for its contributions to oncology care, offering cancer screening, diagnosis, treatment, and follow-up services to hundreds of patients daily. And so, Its success illustrates how universities can serve as engines of innovation and social transformation, translating research and global partnerships into tangible improvements in health outcomes and quality of life. Such success stories remind us that partnerships are not merely institutional arrangements, they are vehicles for transforming lives. As the State Department for Higher Education, our mandate is to provide policy direction, promote research, innovation, and scientific advancement, and to strengthen institutions of higher learning to support national development. Universities occupy a unique position within this ecosystem. They are centers of knowledge creation, innovation, and talent development. Globally, more than 70% of scientific research is conducted through universities and research institutions. The world's most transformative health breakthroughs, from vaccines and diagnostics to digital health solutions, have emerged from universities across the world. Kenya's universities are increasingly contributing to this global knowledge economy. Across our institutions, researchers are developing solutions in disease surveillance, digital health system, biomedical engineering, genomics, pharmaceutical sciences, and public health. However, our ambition must be greater. We must strengthen research infrastructure, modern laboratories, innovation hubs, and multidisciplinary collaboration platforms that bring together health sciences, engineering, information technology, environmental sciences, and social sciences. The future of healthcare will not be built by one discipline alone. It will be built at the intersection of all these disciplines with human-centered design. Distinguished ladies and gentlemen, research achieves its greatest value when it improves people's lives. One of the most powerful examples that I just shared was research-driven. What began as a collaboration to address HIV/AIDS has evolved into one of Africa's most successful academic health partnerships. And this offers lessons for our universities to collaborate across borders with a shared purpose. Research becomes more than an academic exercise. It becomes a force for social transformation. Distinguished ladies and gentlemen, the World Health Organization estimates that the world could face a shortage of nearly 10 million health workers by 2030, with Africa carrying a disproportionate share of this burden. To address this challenge, Kenya must continue investing in the education and training of healthcare professionals, researchers, innovators, and scientists. Our universities remain at the heart of this effort. Through partnerships that are very, very important, such as KUKA, we are strengthening postgraduate education, joint supervision, research mentorship, curriculum modernization, and exposure to global best practices. We are equipping young professionals not only with technical competencies, but also with critical thinking, innovative skills, and entrepreneurial capabilities necessary for the future of healthcare. The healthcare professionals of tomorrow must be capable of working across disciplines, utilizing emerging technologies, interpreting complex data, and responding to evolving health threats. And that future begins with our universities collaborating with KUKA. The government of Kenya recognizes research and innovation as a key driver for social transformation. Innovation, therefore, is not merely a health issue, it is an economic issue. By strengthening research and innovation ecosystems within universities, we are investing in Kenya's competitiveness and resilience. Distinguished ladies and gentlemen, one of the greatest challenges facing higher education globally is ensuring that research moves beyond publication and reaches the people who need it most. We are therefore challenged to strengthen pathways that support commercialization, technology transfer, intellectual property protection, and startup development. This requires stronger partnerships among universities, government, industry, healthcare institutions, investors, and development partners. The private sector has a critical role to play in scaling innovations emerging from our universities. Similarly, development partners and NGOs continue to provide invaluable support in research funding, implementation, and capacity strengthening. Together, we can build, and we must build, a vibrant health innovation ecosystem capable of positioning Kenya as a regional hub for health, research, and innovation. Distinguished ladies and gentlemen, recent global experiences have demonstrated the importance of integrating approaches in addressing public health threats across disciplines. Universities and research institutions are uniquely positioned to drive One Health solutions through interdisciplinary research and evidence-based policy making. As I conclude, let me reiterate that the future of health in Kenya and Africa will not be determined by challenges alone. It will, ladies and gentlemen, be determined by how effectively we respond to those challenges through partnerships, innovation, and investment in our people. The Kenya-UK partnership demonstrates what can be achieved when institutions work together in pursuit of a common purpose. The award-winning cancer diagnosis research collaboration and AMPATH give a clear way forward on what lies ahead in terms of discovery through this partnership. I will leave you with the words of Nelson Mandela. Education is the most powerful weapon which you can use to change the world. Today, we can confidently urge that research and innovation are among the most powerful tools we possess to improve health, create prosperity, and transform lives. Let us therefore continue building strong partnerships, nurturing talent, investing in science, and translating knowledge into solutions that benefit our people. Together we can and we must build a healthier, more innovative, and more prosperous Kenya, Africa, UK, and the world. Asanteni sana. God bless you.
Thank you very much, PS Dr. Beatrice Nyangala, for that speech and representing CS Education. We'd like to first thank all the VIP guests for honoring this invitation.
Okay, so this is what happens when you read the speech, okay? And now, standing in the feet of my cabinet secretary, strongly, it is now my pleasure and distinct honor to open this conference.
Thank you very much, PS. Now this conference has been blessed with our PSs, His Excellency, the High Commissioner, and our CS in absentia. So I would like to quickly, in the interest of time, move to the next items on the agenda. We before departure, we'd like to do a group photo here in front. Allow us to do a quick rearrangement of the seats here, then we can invite you for the photo session. Then I would like also to KUKA coordinator, John, to say a few things, housekeeping things and announcement before we move into the photo session.
Thank you everyone for coming. I think we have two guests who would like to honor who have been part of our journey for the last 5 years. And in the room here today, we have the two anchors in the UK. And I would like them to stand up. Our former ambassador, Manoa Esipisu. Is followed with our former ambassador deputy. Ambassador Kiari is behind with us. And I would like to say that in 2000, in the winter, they opened their homes for me to be able to work with them to bring back live health partnership between UK and Kenya. The second individual, I think we would like to honor, who has been highlight of our KUKA summit. You can put the video of our president to show that we are very keen to honor our speakers, as well as those who have been very instrumental, inspired us to where we are. Make sure it doesn't make the noise we've seen, please. While he's doing that, we like to honor our second home in the UK, King's College London. Graham, please, you can stand up. Make the noise we've seen. Make sure it doesn't make the noise please. While he's doing that, we like to honor our. While he's doing that, we like to honor. Just before Graham, if I ask you to stand up to demonstrate how powerful the team we have here. I will use King's College as a sample. Its nursing program is ranked #1 in the world, globally. That is not a mere achievement, if you can stand up. The other item I would like to highlight, their medicine program is ranked #5 globally in the world. And also dentistry, I can go as many, but just to demonstrate the quality and the standard of the group in this room and the impact we have. I also missed our best friend from Christie Hospital. If you can please stand up, Professor Cohen. Christie Hospital is #1 hospital in Europe and the second largest hospital for cancer care in the world. And we would like, and just to show the breadth, the two institutions which you have just mentioned, they received Nobel laureate for radiotherapy, and King's College Nobel laureate for DNA discoveries. So you are in the best place as a country. Are you ready? In the meantime, we will ask the media.
So I am
very happy that we are making this progress together. And this consortium of universities here in the UK, working with us in this Kenya-UK Health Alliance, is a step in the right direction and has the support, the endorsement of my administration. And you can count on my support and count on my leadership as we work on this together. On behalf of the government and people of Kenya, I express my very sincere appreciation to all the members of the Kenya-UK Health Alliance, to His Majesty's government, and to all our partners for your steadfast support. This collaboration is central to our national development goals and to the health and well-being of our citizens. I reaffirm Kenya's commitment to deepening our partnership with the UK in health, and looking forward to welcoming you all to Kenya as we continue this shared journey of collaboration and progress. And I thank you very much. So,
as protocol observed, I would like to request our principal secretaries and our chief guests, Cabinet Secretary for Education, to come forward as we do a photo for this session, and group photo, please. And we would like the team, the media, to get this podium ready. Please. Please take the photo of our chief guests here. Our next team is all the guests from the UK. If you can join the first chairs so that the VIP sit down, then the rest stand behind. Can we have the representative for the Kisii governor to join us, please? Representative for the Kisii governor, please. Yes, he's coming for the governor. Oh, is he?
Thank you very much. I think VIPs now can leave at their own pleasure. Yeah? Okay.
I think we haven't finished. If you can sit down. Sit down, simply. Their team from the British High Commission, if you can join us in front, please. Yeah. The team from the British High Commission, please. One more group, our Kenyan universities, please join us as you try to club up, because the CS is here. Please, the universities, Kenyan University here. Moi University, Kisii, University of Nairobi, any Jaramogi Oginga Odinga. Next will be Ministry of Health here. We'll join after the Ministry of Education.
You can see John belongs to all the groups. Okay, last Ministry of Health and Ministry of Education staff, including sagas. The last one, eh?
Ministry of Health, is there anybody left? We like to have the Secretariat to help me shape this meeting. Despite the challenges, we pulled it up. Yes, yes.
Last but not least, private sector. Okay. Okay. Private sectors, faith-based sector. Have to manage the two. I think those next, if you have not been in any of those category. So last but not least, please prepare. Students, interns, delegates, distinguished delegates, prepare yourself. Thank you. Now, one more for the delegates.
One more delegates. One more group. Yes. One. Yes. Can we have Richard Cohen? You are honored here, and we would like to honor Christie Hospital. We like to honor the Christie Hospital. After this, please. Alison Sana, please, from Christie Hospital.
Alison.
We need you. You are honored this morning by our High Commissioner, and we'd like to have you in front. We finished with the students. Not yet. Okay. Thank you very much. We'd like to Christie Hospital representative, Professor Richard Cohen and Alison Sana, please. And all Manchester team who are the foundation, please forward. MIS team, MIS, please forward. Manchester team, all of us who are the founders of the Alliance, and King's College, join forward, please.
Thank you. Thank you. I think that's all.
Request by the PS, the CS guest, that everybody here, please come to the front for the last photo. Everybody present. Yes. Just push the chair slightly in front. Just we need to push the chair in front, yeah. If you are comfortable, your photo to be on the media, please come forward. Thank you very much. There's a cup of tea outside for break, and we'll be back in 15 minutes. It's tea time. It's tea time. In the next 20 minutes, tea time, tea time. We just need to make sure our VIP, you're holding room.
He didn't invite me. All the secretariat, you missed it. He didn't come. He did.
Well done. It takes many to
Take one hit. Yes, yes, yes.
It's tea time, time for a break, but it's also time for networking. Please interact, network, get to know who sits next to you, get to know the contribution. The bamboo room, on the other side, where pitches can be made. So after lunch, we will leave the plenary and head across the road to the bamboo room, yeah? Big bamboo, yeah? That's the room we're in. And we're looking forward to ensuring that those of us who are in the investment field, including financiers, we want you there with us because a side has two coins. Who are we pitching to? We have invited a number of equity investors to come along and investment companies to be here with us today. So we want to get the full benefit of that interaction. And we will leave the medical section, the track 1, the track 2, and the track 3 to continue with their deliberations. But you're most welcome to join us in that room. It can accommodate 30 people, so have it in your mind if you'd like to join us in the deal room. It's called the Tiba Deal Room. You're most welcome to join us. Thank you. Thank you. So let's reassemble. Where are we? Yeah, Dr. Lucas, are we ready? I think there's still quite a number out there engaging in wonderful chit-chat. I think now we are fully aware that we are the legitimate entity of both the Kenyan and the UK government. Many people was worried about the mandate on which we took on the responsibility of organizing this Kuka conference, but you're witnesses to the presence of Kenya government officials and UK government officials. Actually, Kuka was inaugurated during the period of office of our former president, His Excellency Uhuru Kenyatta. And the ambassador, Manoa Ibisu, who was here, he was responsible for that engagement and ensuring that the alliance got a legitimate mandate from government. It was further endorsed in 2025 when our current president, and you saw his speech, went to King's College and reaffirmed the need to have a Kuka alliance to deliver on the bottom-up economic transformation agenda. So basically, we bring together stakeholders from the industry. We bring together the highest level of professional know-how that we have in this country. And Dr. Jorobi, thank you for your wonderful work that you've been doing and promoting medical research, which has now taken on its own characteristics on the world stage. So thank you for that. Come on, round of applause for Dr. Jorobi, honestly. You must have seen him trending. It is not only the youth and the Gen Z who trend on social media. I saw him on social media. I saw him on LinkedIn or somewhere like that where I sit. So, you know, we're very thankful. We're very thankful. And there are so many Kenyans out there in the diaspora that would like to have ideas, come with networks, so much they have to contribute. And there's a sense of timidity. There's also a sense of distrust. So where we sit at the moment in the diaspora is that most of the resources flowing from the diaspora into Kenya, which at the moment stands at $5.1 billion annually, found its destination in welfare and not in investment. So we have been working as a diaspora organization with the Kenyan government to the State Department of Investment Affairs to look for different products to attract our diaspora population, because we feel that it's an unrecognized group of Kenyans, and we have been promoting the notion of a 48th county. So if anyone here is of residents of the 48th county, you'll know they are from a diaspora origin. And that's where I belong. Because oftentimes I go into an Uber, where are you from? Where are you from? Where are you from? I'm Nairobi. Nairobi? Where in Nairobi? I said, okay, then Kenya. Which part of Kenya? I reply, the 48th county. And now that sets in motion a discussion that lasts me throughout my journey. So we're here today. We would like to move forward with the program. And the first panel Yeah, sorry. Just taking instruction from the boss. We all have reporting relationship with our bosses, and Dr. John is the boss of the Kuka. And I will follow out his instruction. Just going back, we're talking about the diaspora, the importance of the diaspora. And I think we need to recognize the diaspora. Here today, without Dr. John's initiative, where would we be? Yeah? He came to Nairobi, he didn't have a secretariat, yeah? And he found a friend who probably is the icon in the field of diaspora. I think he's, Dr. Shem, are you here? Maybe he's still having a cup of tea with the others. But Dr. Shem represents KDA, Kenya Diaspora Alliance. And Kenya Diaspora Alliance has 67 affiliated diaspora alliances throughout the world and has been involved in diaspora affairs for decades. Dr. Shem and his team has been ensuring that from the policy point of view, the government is sensitized to the requirement of the diaspora. There's progress being made. In recent time, in 2025, we had a new diaspora policy. The 2015 policy was revised, and we have a new diaspora policy. Right now, diaspora is the flavor of the month because diaspora accounts for the highest foreign exchange input in the country in the form of remittances. If you look at the trailblazers in terms of export earnings, the horticultural sector generates 1.2 billion, and that's one of the biggest trailblazers. Tourism, again, a similar amount. But right at the top of the scale and growing exponentially is the diaspora remittances. So we give thanks. We should accommodate our people as they return. We should mitigate on issues of trust, because that trust is still a matter to be dealt with. Fortunately, in the past, when funds were returned to Kenya by our diaspora personnel to their families, and the requirement was for real estate, very little was offered in the form of real estate. Now we have Nairobi being built up now. The Chinese and others, Somalis are giving us affordable homes all over the country. So at least that first an important item of shelter is being looked after. And diaspora are more confident that they can now send their money to a realtor to ensure that that money is spent. Yes, Dr. Lucas, are we ready to go? Yes, I'm on a time limit, so let me stop waffling. So we have the next panel, and our moderator for this panel is Dr. Lucas. Please give him a round of applause. Thank you. He's our rock star, recently returned from the US. God, give him a round of applause.
He makes it sound like I'm fresh off the boat. I'm not. I've been here for quite some time. Excuse me.
Sorry, as Dr. Lucas takes over, we have been told that a Center of Excellence, an oncology center, is being established in Kisii. Yes, and we are fortunate to have a speech made to be read, a speech from the governor of Kisii to confirm his approval of what we're doing and to encourage us to be more forthright in the delivery of health facilities in the Republic of Kenya. So I think that speech is being read by Dr. Kinani. Are you here? Can you come to the forum, please? Dr. Kinani? Mzee wa kazi, please. As I said to him this morning, he looks like $1 million on legs. Am I not correct? Please welcome Dr. Kinani to the forum to read the Kisii speech. He's a special advisor to the Kisii governor. Please welcome him. Thank you.
Thank you, my brother. I'm going to read His Excellency Honorable John Simba Arati's speech, which he would have done himself early this morning. He was with us last night at the reception at the British High Commission's residence, but he had to travel to Kisii, and he directed me to read this speech on his behalf. So I'm going to read it verbatim, apart from changing the salutations, because the salutations may not be relevant at this time. So, protocols observed. Ladies and gentlemen, allow me first of all to express our sincerest thanks to the British government and partner institutions from the UK, for the support we as a county, and indeed the country, have received through the KUKA collaboration. Some of you may not be aware that the discussions that led to the signing of the Kenya-UK Health Alliance, which we called yesterday the KISI-UK Health Alliance, were initiated by Kisii County. We were fortunate in having one of our sons in the UK, Mr. John Guto, whom we contacted and he agreed to secure an invitation for a delegation from Kisii County to meet with Health Education in England, the University of Manchester, Gafi, and Amref UK. Since the Lake Region Economic Bloc had tasked Kisii County to spearhead the health pillar within the bloc, our discussions centered mainly on the health sector. When we received a formal offer of UK 1 billion sterling pounds for improving healthcare services in Kisii County, we decided that we couldn't keep this to our county alone, but had to bring this matter to the attention of the national government, as this opportunity would assist our country in the attainment of one of our country's Big Four agenda, that is universal health coverage. In July 2021, our former president traveled to the UK and witnessed the signing of 2 MOUs between the United Kingdom and the government of Kenya. These were, 1, workforce collaboration in healthcare, and 2, the launch of the Kenya-UK Health Alliance. He then announced that Kisii University would be a regional center of excellence in health education and training. In September 2021, a Kenyan delegation traveled to the UK to firm up the protocols for the collaboration. The delegation comprised of officers from the Ministry of Health, Ministry of Labor, Ministry of Foreign Affairs, the Nursing Council of Kenya, Kisii County, and the Council of Governors, since health is a devolved function in Kenya. The discussion centered around 2 main issues. 1, migration of Kenyan nurses to the UK, which has been ongoing, and the Kenya-UK Alliance activities. When the current government came into power, we presented the program to His Excellency, the President at State House, Nairobi. The program entailed the adoption of the hub and spoke model borrowed from the UK, with county governments and their respective universities collaborating together to deliver healthcare services. His Excellency, the President, recommended that it be submitted to Cabinet for approval. Following Cabinet deliberation on the proposal, Cabinet Office released an executive order on Tuesday, 28 February 2023, stating that a first step towards actualizing government's universal health coverage on non-communicable diseases, respiratory diseases, sickle cell, malaria, HIV, mental health, and cancer, that these services would be offered through centers of excellence to be established in Kisii County, Kisii University, Nakuru County, Egerton University, Kisumu County, Maseno University, Kakamega County, Masinde Muliro University, Bungoma County, Kibabi University, and Bomet County, Bomet College. The British government gave their sovereign guarantee for the funding to be availed by the Kenya United Export Finance. The government of Kenya, through the National Treasury, was expected to do the same, but has yet to do so. I trust that this will be expedited for the activities intended in the program to commence soon. Based on the experience to be gained from the this pilot, the program was to be rolled out throughout the country to actualize our country's universal health plan. It is important to recognize that as a country, we spend over 15 billion shillings every year on medical services outside the country. Also, we spend over 76 billion shillings on importation of medicines. With successful implementation of this program, we will not only arrest the foreign exchange outflows, but will also become a medical tourism center within the region. Since the signing of the partnership, we have carried out numerous activities that we have had significant impact on the delivery of healthcare services to our people. Since I cannot mention all of them, let me just mention a few to demonstrate the importance of the mutual collaboration between our two countries. We successfully carried out joint research on the achievements of masks in the country in containment of the spread of COVID, whose results were published. Through a student exchange program, we have received 3 cohorts of students from the UK who have come to study in our hospitals, and 2 cohorts of our students who have gone to the UK to study in UK hospitals. We have received state-of-the-art equipment for making Kenyatta University Teaching, Referral and Research Hospital a center of excellence for cancer treatment within the East African region. In partnership with the University of Manchester, the Christie Hospital and Kenyatta University Hospital, esophageal cancer screening was carried out in 4 participating counties, and in Kisii, over 1,000 people were screened, where 15 patients were detected with esophageal cancer and are currently undergoing care under the Sambai project. Kisii County has signed an MOU with Sambai to have research in breast, prostate, and pancreatic cancer. This is in collaboration in a project between Morehouse University in the US, Nottingham University, King's College London, University of Glasgow, among others. This will also assist us develop a cancer registry that is now lacking. The UK Emergency Medical Services undertook a 1-month training program for our ambulance staff, where over 60 staff from both institutions, that's Kisii University and Kisii County, acquired important skills on emergency medical responses. From these few examples I've highlighted, it's clear that this collaboration is indeed mutually beneficial and should be strengthened and continued. I wish to remind us that we now live in an age where globalization has connected the world through technology and travel, and we have become one large village, demanding a paradigm shift in our global development agenda. Leaving any part of the world behind will over time have negative ramifications to the rest of the world, and COVID-19 made that very clear to us. Economic isolationism is the wrong way to go, and no generation has had the opportunity as we have now to build a global economy that leaves no one behind. This we can achieve by coming together and forging partnerships based on our unique comparative advantages. Our collaboration so far has shown that we are on the right track, and history will judge us harshly if we waste this opportunity. We continue to express our gratitude for the willingness of our friends from the UK to partner with us as we continue to strengthen the long historical bonds we have cherished over the years. Thank you.
Thank you very much, Kisii County. Where is Lucas? We move to the next panel. Yeah, thank you.
Okay, so I was interrupted earlier on, and the speech was really good, but I was on a roll, right? I guess now I'm going to start backwards again. So here's a challenge to each and everyone here today. There's a lot of times we go for these sessions, wherever we go, and we listen, we have some tea. Normally when I go for conferences, I add a little weight, because there are mandazis that I don't eat at home, and other cookies. But then, what did you take as you? Not only what did you hear and take, what resonated, and what are you going to use? You spent your time here, right? What is the one thing or two things that you'll say starting Monday, I will put this into practice? Whether it's the way you think, whether it's the way you share, whether it's the way you communicate, the way you work, how you look at things. What is the one thing you're going to take with you? Okay, next panel. We're going to join panel number 6 for those ones who have programs, panel number 6 and panel number 7. Now, for those who are, no, we didn't have Ugali, so nobody's going to be dozing. So we're going to have a few people here. I'll start by calling my brother, my new brother, brother Uj. Uj. He's my new brother. Please have a seat. And then there is also Mr. Karen. Uj is from Bupa. There is Mr. Karen from the British High Commission. Okay, there's gender balance. Next, I'll call Wamboi. I won't say the last name for a reason. Wamboi, please join. And then we have Dr. Chelule. Okay, my gender balance is going. Then we have Dr. Karanja. Is Catherine French in today? Catherine French? Okay. So this, for those who have programs, there are two things here. There's two panels that were joined together. And the panel is about technology, about IP, intellectual property. Not somebody, I said IP and somebody said inpatient. No, no, no. I mean intellectual property. So intellectual property, we're going to talk about technology, innovation, and then intellectual property. In terms of not the legal side. There's going to be a legal presentation about IPs later on today. But this is just generally how do we work with this. So I will allow each one of them to give us like maybe 2-minute conversation about what they do, what they think about those points, and then we'll have questions. Again, remember, what are you going to take from this? What are you going to do with it? How are you going to improve it? That's innovation, even from what people say. Okay? So we'll start from, I think we'll do the gender balance now.
Is it good morning or good afternoon? Good afternoon. That's really funny that I'm the gender balance. I'm the center. How did I get sandwiched? My name is Engineer Wamboi Nyabero, and I am very happy to be here today. I'm the CEO and founder of MedDevice Africa, which is a med technology company. We are looking to do many things around all of the items that have been mentioned. So I'll start with research and development. We're doing research and development of medical equipment, which is one of those things that gets forgotten when we talk about healthcare. We talk about workforce, we talk about the clinical side, we talk about pharmaceuticals, we talk about vaccines, and I say medical equipment and people go, oh, yeah, that's also important. But it tends to be the last thing that people think about. So we're doing innovation of medical equipment for our context, very specifically for our context. We are developing intellectual property around medical devices and equipment, and we are collaborating with other people. So we're not doing it just as an organization, even though we do have the expertise to do that, but we reach out into the ecosystem because I do believe that it's all about the ecosystem, like my friend Dr. Karanja and I were just talking about. And as we build our ecosystem, we're all going to be successful. We cannot do it by ourselves. I'm not sure I've covered everything, but I'm sure I'll get an opportunity to do so as we go along.
Thank you very much, Wambui. I think you'll pass the mic to Karen, who's going to be next.
Thank you, Lucas. Good afternoon, everyone. My name is Karen Garcher from the British High Commission. I'm part of the trade team there, and I lead on trade policy and market access. So I'm responsible for the UK-Kenya Economic Partnership Agreement. So that's the trade agreement between the UK and Kenya. And on the market access side, I work with UK companies that are sort of facing any hurdles or obstacles, either with the government here or regulators. So just 3 quick points that hopefully I can make within 2 minutes. First of all, we're working with the Ministry of Health on their health, product and technology policy. So we've been working with a local consultant on forming a draft on that, and we've been involved with workshops and bringing together stakeholders to ensure that the best possible policy for Kenya is in place on that. The second point, and linked to this policy, is actually the health technology assessment process. So we brought in NICE, which is the UK's National Institute for Healthcare and Excellence, and NICE have been supporting the Ministry of Health with actually how we sort of operationalise the assessment process, what panels are convened under that, and sort of modelling it based on how it's sort of run in the UK. And I know the team from the Ministry of Health and other stakeholders in Kenya have had the opportunity to sort of shadow the committees in the UK to understand how it works and why that's an important part of the process. And the third and last point I just wanted to cover is IP, so intellectual property. I think this is important not only in a healthcare perspective, but I think it's a societal issue. And the reason I say that is, just to give you a quick stat, around 60% of all spirits, so alcoholic spirits in Kenya, are illicit. So people are drinking alcohol, which they don't know what's in it, and it's not the actual true product. Now just think about sort of the public health implications of that on one side, but if you then look at actual pharmaceutical products, we know as well there's counterfeit pharmaceutical products in circulation within Kenya and East Africa. So we've been working with the Anti-Counterfeit Authority. It's actually World Anti-Counterfeit Week this week, so I was with the ACA yesterday to sort of celebrate that and kind of talk about what more we can kind of do together. But I think the key point here is there's a draft intellectual property policy in Kenya, and we want to make sure that that's implemented and benefits not only the healthcare sector, but it's a cross-cutting policy that's important for research, innovation, and the future prosperity of Kenya. Thank you.
Great. Next is going to be UJ.
Thanks, Lucas. Good afternoon, everyone. So my name, everyone calls me UJ, it's easier. I'm the CEO and Principal Officer of Bupa here in Kenya, and I'm responsible, my remit expands beyond Kenya across Africa. For those of you who are familiar with Bupa, some of you are, and for those of you who are not, Bupa is a global healthcare institution. It's not, I mean, most of you will assume it to be an insurance company, but it's not, because we have the entire ecosystem in terms of how we operate. So we have hospitals, clinics, clinicians. We are really focused on the providing medical rather than just the insurance side from a funding perspective. And our purpose is longer, healthier, happier lives and making the world a better place. And we take care of almost 70 million customers globally. We're in over 190 countries, and Kenya is our latest addition to that from a branch perspective. So we're really proud to be here in Kenya, and our ambition is to really drive forward the health agenda, not just from a private perspective, but just right across the board, to raise awareness on the importance of clinical provision standards, and also discipline in the insurance sector as well. I think that's really important to ensure sustainability, to ensure that more people have access to good healthcare, both from an insurance perspective and also from a provision point of view. And data data, I was talking to Dr. Lucas earlier, I think data is a key part in what we do, and from an IP perspective, that's definitely our bag. So we have a wealth of data, looking after 70 million customers globally. We have a great understanding and in-depth view of trends, and we use that from an IP perspective to deliver value proposition into markets where we can change lives.
Great. So next is going to be Dr. Karanja, and there's a reason why. There's a reason why Dr. Chilule is last. So Dr. Robert, I think he was here yesterday. He said a couple. So maybe instead of 2 minutes, he'll have a minute and a half because he had said some stuff yesterday. But it's okay. Go ahead for 2.
Oh wow! I wish I was also not gender balanced, but Robert Karanja is my name. I'm the founder and executive director of BioLinks Africa. What does BioLinks do? We link academia to industry. And maybe just by a quick show of hands, has any of you who has actually developed their idea into a product and actually seen it touching patients' lives? Just raise your hand, just a very quick. Excellent. Please, we exist for you. So we are a platform that basically provides capacity and funding for practical academia. I call them the pracademia. People who are doing research to solve problems, to translate their ideas into solutions and actually take them to the market. We also link the Kenya, very nascent Kenya biotech innovation ecosystem with the UK much more mature innovation ecosystem by doing product development and commercialization in both countries. So we're working in Kenya and we're also registered in the UK, operating as a venture studio in terms of creating startups, developing the products and launching them in the market. So thank you so much, and looking forward to participating more.
That was good. That was very good. Dr. Chilule, please guide us and tell us where you're from, and then all these folks say something, how do they fit under your docket?
Okay, thank you. My name is Ken Chilule. I'm the CEO of Special Economic Zones Authority, where we provide tax incentives for people who are in the space of manufacturing, value addition, for purposes of maximizing their resources to create products both for local and international market, and in the process create jobs for the many Kenyans who are educated and currently don't have employment. So taxes include exemption from import duties, stamp duties, withholding tax. Corporation tax is reduced to 10% instead of 30% for 10 years, 15% for the next 10 years, and 30% after 20 years. You recover all your capital expense before you pay any tax. And where you don't have personnel or skills within the country, you can have up to 20% of your personnel coming from outside, provided for in the law. However, I'm also from your sector, having spent over 20 years. So I've worked for quite a number of companies and government agencies in the sector of medical industry. Previously, I was in the UK, worked for a number of multinational, working with Association of British Healthcare Industries, NICE. I started as a designer into the workshop floor, regulator, used to work with people like British Standard Institute, and then moved to Kenya. In connection with what we are doing now, currently I work with a number of people. First, I'm involved with Kenyatta University. We have a program called Medical Device Innovation. We're trying to build capacity among university students to make products. So there's a consortium with some funding given to us. I'm also working with the Kichabe hospitals, medical practitioners, where we want to set up a facility in one of our zones called Naivasha Special Economic Zones. We want to do prosthetic manufacturing using 3D printing technology and making drones for delivery of whether it's medicine or devices, last mile delivery. And in that zone, we've created up to around 500 acres where we want to provide an ecosystem for this team, where specialized facilities such as ETP and other such like, or irradiation, you think of gamma or electronic beam radiation, we will provide for within that facility. And at the personal level, I'm also a patent holder, both in the UK and in Kenya. And what is interesting, we've been able to commercialize the patent in the UK, but have not been successful in Kenya.
That's very interesting. So, hand clap to all of them. I mean, this is amazing. So, again, gender balance. I'm going to move just one step to Wamboi. When Karanja, Dr. Karanja, I call him Karanja because I know him. When Dr. Karanja asked how many have actually gotten a product to market, she put her hand up, right? So I want her, could you please, in line of what has been said here, and in line of what Dr. Chilule has just mentioned about his IP product, and then also Dr. Karanja talked about IP in London. How do we use the technology we're talking about, the stuff you're talking about? What do you think is a path towards IPing it and being able to use it here, create the jobs and wealth that we're talking about? I don't know whether that's too difficult. No. Yes.
It's a big question, but I'll start by saying a little bit about the product that we have in market. It's actually a software product, even though we are a hardware company. And there's a reason for that. As we were doing research and development of our devices and equipment, we went to a lot of hospitals. And while we were in those hospitals, we found that one of the big issues that we were seeing in the hospitals was the maintenance, service, and repair of the actual devices and equipment that are already in the hospitals. And so we spent a good part of last year developing software to do just that, and we're rolling it out in hospitals, and we are seeing some really good returns. Now, we also have a patent for that software, service, and process, which includes some artificial intelligence and a few other things. But why that's important, because we could just develop the software, roll it out into hospitals, and make a little bit of money, help the hospitals. But I really do feel strongly that intellectual property is an important, a patent, a utility model, copyrights, trademarks, all of it, all of the intellectual property is very important. And I'll illustrate it by talking about something that really surprised me. And it's interesting you talked about alcohol, because I found out that there are traditional alcoholic ways of making our own brews that have been patented in other countries, and we have lost that intellectual property. I don't know if any of you know about that. So, yeah, Moratina, exactly. So we lose our intellectual property, whether it's Moratina, whether it's our Kiondos, whether it's, whatever it is. And when that happens, people elsewhere in the world are able to commercialize and make a profit, but more so, I think, appropriate our culture and what's coming out of our brains and our minds. So I think it's very important, even as we do things, whether you're in academia or in the private sector, that we are actually being very intentional about filing for intellectual property. And I don't know if I answered your entire question.
You are actually almost there. I'm going to pass the next part to UJ, and he's going to continue with this. So UJ, she talked about, and I think this is something that Dr. Okutoi, who's somebody I know very well too, about maintenance and services in the hospital, some of the equipment not being maintained the way they should. So how will that influence the healthcare provision of like what Bupa will provide in terms of the maintenance and also the calibration and other things?
So I mean, that's an interesting question. So if there is a lack of maintenance, calibration of medical devices fundamentally impacts provision capabilities, right? So it means that the diagnosis, the treatment that the individual receives is not adequate and potentially like fatal in some instances, a worst case scenario. So I think there is a huge dependency on medical providers being able to keep and maintain equipment in an auditable way. So I know that, like, I won't name names, but as part of what we do from a Bupa perspective, when we onboard a provider, is we conduct regular audits on their clinical standards to make sure that actually where we recommend as a networked provider, they're able to deliver on the service that is in the best interest of the consumer. So I think there's got to be more of that rigor introduced at an industry level to make sure that there is no detriment.
Oh, nice. So next time the doctors ask, please pass that to Karanja, ask if the equipment they're using is calibrated. Just ask, when did you last calibrate it, and see if it's on point. Now, I am aware that one of the things Dr. Karanja is working on is one of my favorite subjects, which is genomics. We were talking about calibration of equipment. How about calibration of the material that is going to treat us? Are we getting the meds that actually should fit us as people who are secondary consumers of the medications that are being developed? So in terms of genomics and pharmacogenomics, you have 2 minutes to say something of what you're doing about that.
Thank you. So one of the challenges we face when it comes to oncology and the care that we have access to in Kenya is we treat everybody as if we are all the same. And for oncology, it's really difficult because, especially here in Africa, our genetic diversity is second to none, and more so in East Africa. So what works for patient A does not mean it will work for patient B or patient C. And ideally, what needs to happen is what happens in most other countries that are able to afford it, most of the developed countries, is applying precision medicine, where we look at your DNA as an individual, we analyze it, and we're able to then use pharmacogenomics, in essence, understand what kind of drugs would work for this particular individual. So if you look at what happens for us today, if you are, in most cases, it's really sad, we capture our patients, we catch the diagnosis stage 3, stage 4, and the doctor is literally rolling the dice. They'll try off, let's first start with this drug, and then will it work, observe, we'll switch up to the second and the third. And if you're in stage 3 or 4, these drugs are not helping you. They're actually quite toxic. So they're adding a further burden of toxicity on you. And I was surprised when I looked at what is our survival rate in terms of 5 years post-diagnosis. For Africa, it tends to be around 30%. Globally, it's around 70%. And part of that reason is because of course, the late diagnosis. But the other bigger one is actually just lack of precision medicine. So what are we doing? We've established a genomics platform that actually can now address the sequencing needs for pharmacogenomics. We are currently actually onboarding partners that can partner with us because we're not healthcare providers. But we'd also want to reach out to our UK partners because this is one area where UK has done a lot. And we'd love to be able to say, how can we, and instead of reinventing the wheel, what are the hacks? How did you roll it out in the UK? How have you made it cost effective? How can we demonstrate, especially for our social health insurance, SHA, that this is actually something that we need. And it's not just good for the patient, but it's also cost effective for the health system.
Great, and I think Eugene wants to add something, and then I'll come to Karen. Eugene, and then I'll come to you.
Sorry, just to add on that, I think genomics is a fundamental investment that everyone should be making from a healthcare perspective, right? Because not just from a treatment side, but more from a prevention side. So from a Bupa perspective, genomics is one of our key pillars in terms of what we're developing out, in terms of how do we treat or bring stronger value propositions from not a sick care, because right now, if you look at healthcare, it's not healthcare, it's sick care, right? Because after the fact, you want to bring people into a healthcare scenario, it's more preventative. And the only way you do that is through the genomics side, right? So, and I think that's super key. We should definitely connect after this.
So Karen, you talked about the healthcare tech process, and you talked about the various documents and policies that have been developed and that are in process, some of them. How do we tie what we were just talking about we're talking about the calibration, we were talking about the things like genomics, we're talking about how do we tie the being able to market a product locally that is being marketed elsewhere? How do we tie all this together to provide the relief or the care that we need to provide for our patients? That's a big one.
That's a great question, Lucas. Nice and easy one there. I think I'm going to take it back to IP, because I think we've heard a lot today about sort of local manufacturing and investment in kind of the healthcare ecosystem here. And the big thing for me is sort of, I think I mentioned earlier about, it's not just foreign investors coming here and benefiting from a commercial perspective, but also it's a win-win on the IP front of where Kenyan researchers, innovators, entrepreneurs all have their IP protected, and they know that it's protected in Kenya, within East Africa, across Africa, and globally. And I think once you've got that ecosystem in place where you know there's a robust legal framework in place to protect that, in theory, everything should follow that. So in the fight against counterfeit goods, counterfeit products, or unauthorized use or licensing of technology, software, all that sort of stuff, you make sure that you're actually using the legitimate product for its intended purpose to make sure you're delivering the best outcomes for patients, and you can trust and rely on the tools and equipment that you've been given.
Excellent, that's really good. I think we'll pass to Dr. Chelule, and I have a specific question for you. Before that, Tesla. Who knows about Tesla? It's a little company called Tesla. So part of the reason why Mr. Him is one of the rich people in the world is that when he got into Tesla, let's not talk about the history, but when he got there, he promised that he'll have 3/4 of profitability, and if he achieved that, then there was this huge payout. Because at that point in time, nobody believed it would be cost effective to have cars that use what? A battery, right? Part of the reason he did is that all the IP from the batteries are free and open. So any other company can actually take it as long as you share back any improvement you do on the IP. As we speak right now, name a car company that doesn't have an EV unit. There's actually none. All of them have EV units. So in as much as we want to protect the IP, how do we make sure it is a way to encourage development and innovation on the same IP that you came up with? So how do you open your IP for improvement so that it improves to other people? But that was not my question to you. My question was, how does CESA support or help protect and support IPs because a lot of people sometimes are trepidatious about getting IP because somebody's going to take it up.
I think by registering your IP, you already protected it from being stolen. And IPs last for 20 years. So within that period, you should have done something with your IP. But as a program, within the Special Economic Resource Program, so we run various schemes. Among them is something called Science Technology Park. And this is a scheme purposely introduced targeting research and technology organizations, the universities, the research institution, and similar ones in the private sector. Through the experience I've had, it takes a long time for a product to come to market. Once you have an IP, then you want to see, can it be used, can it be deployed in a manner the designer or the inventor intended it for. So you have to go through a series of activities. Among them, you have to do cadaver trials, animal trials, clinical trials, certification, and all those. So from our side, there is provision both at Science Technology Park scheme and Industrial Park for such organization because it's also capital intensive.
Correct.
You need a lot of money, probably for equipment. You need a lot of money to undertake your research.
Exactly. That's why I want to interject. Because what you just said how expensive it is. But what I heard, how intensive and how expensive it is. So that's why I'm now coming back to the capital. Let me look for the words that you say, the corporate tax and capital words that you are, capital support. What specific support do you give in that whole process of trials and being able to realize that IP? What does CESA support?
So let's start with the investment allowance that we offer. So if you're putting up a state-of-the-art facility with all the equipment, so your CapEx is 100% recoverable.
CapEx 100% recoverable. Write that down, please. Next.
Any material that goes into making your product that comes from within the country, and assuming your target will be Kenya, when you sell it back, that cost of adding value is discounted.
Discounted or?
So in other words, there will be no duties applying to that product based on the material where they came from. However,
this is good information, guys.
Any material that goes into our zone, we know are intended for purposes of making the product. So depending on the final destination of what you're making, if it is to the country or East African region, duties will apply or may not apply depending on the source of raw material. So if from Kenya, as I said, there will be no duties applicable. But it's coming from outside of East Africa, duties will apply if you're selling to Kenya. And none will apply if you're selling outside of East Africa.
That's interesting. Oh boy, I have a question for you, actually, following what you just said. When you were working on your product, did you know this information and would it have made a difference? The mic is there.
The first answer is no.
It wouldn't have made a difference,
no.
or you did not?
I did not
Okay,
have access to this information.
Okay.
And I suspect that a lot of innovators, especially around medical technology, are unaware of this. Now, I know you said CapEx is 100% recoverable, but for most innovators, getting a hold of that capital to put into CapEx is very, very difficult. So I know I'm not the moderator, but I would follow up with a question. How do we support these innovators to get this capital that will then end up being recoverable?
So I'll also walk through my journey around the research world, and then I can answer your question directly.
Okay, let's make it a little, okay, because I'm going to ask questions. Now, prepare a question or two. I'm sure this is interesting information. I'm seeing a few, Dr. Tara there, I'm sure has a question. I'm seeing a few people, I don't want to name your names. Hold on, look up there, Dr. Keegan, Professor Keegan is there. So go ahead.
In this country, we've cut a lot of funding towards research in medicine. They are all over the place isolated. I've always thought there is need for consolidation so that we can target money to where it is intended. What I see is encouragement of something I call compreneurs, people who compete in every competition to get money and probably don't deliver. So we need to consolidate to make sure that we maximize the use of the resources. In terms of where the money is, my experience is very interesting because investors who come to our zone come in many ways. Those who have money invest directly. Some will want to get an existing business to go into JV. Okay? Others may want to have equity share, they have money. So I think my experience has been it is a lack of bankable projects.
Lack of bankable projects.
A few cases. So if you can package your product, demonstrate this product, there's a market that is viable. I want to believe, because we already have in our zone 6 companies in the medical sector, mainly so there are about 3 pharmaceutical, 1 veterinary, and 1 medical devices, and they are operational.
That's very interesting, Dr. Karanja. This is just 2 or 3 words. You said you have a sort of a you know, a group that you're working with?
Yes.
Do they have bankable projects?
I believe so, yes.
You believe so?
Yes.
So what does bank, and this is maybe we don't have to answer that now. We're going to figure out what bankable projects are. Because you can think you have a bankable, I've seen some pitches, by the way, and I look at them and I'm like, oh gosh, right? The issues between the thought process of revenue, profit, and the issues about projections, and you find people are totally unaware and they're trying to pitch. And as a result, some very good ideas never see the light of day, because when you pitch, because you have one swing, and that swing is off, it's off. Is it bankable or not? We don't know. I'll allow Sam the mic to Professor Keegan here, the question. Oh, you want to finish something? Oh, one more thing, and then
I agree with you about bankability of a project.
Yes.
In Kenya, government has provided for money to lend into enterprises that may want to borrow money from government. So Kenya Industrial Estate can give you up to 20 million.
Did you hear that? I would say, repeat that, please. Which organization?
Kenya Industrial Estates. And they'll also give you a facility where they can house you. So it's not just the money. Kenya Development Corporation can give you up to 500 million. There's a caveat though. In both, you have to provide a guarantee. However, what I know about KDC, currently they are running a single-digit figure in terms of interest rate, courtesy of an advance of credit line by an Indian Exim Bank. So if you bring equipment from India and you borrow money, you will be able to benefit from a single-digit figure.
Interesting. Did you hear that? Write that down.
Yes,
and I know there's a gentleman here. There's a machoka here who has an idea.
Just before we pass on, because I think the question of is it bankable, it also begs another question of bankable to who. So we have different categories of investors. So the investors that will invest in early stage, the investors that need you to de-risk it significantly in order for them to come into the game. And I think now when you're talking to CESA, Special Economic Zone Authority, they are coming when, at this point, it's not, you're talking of maybe technology readiness level 8 going into 9. Now, what happens, this valley of death before CESA and these other monies can come in, who's addressing that? Okay. And I think just on the question of how do we speak, because I'm also very interested in what Chelule is saying. Two quick ones. The first one is we have a lot of innovation hubs. So I'm building a venture studio. Our capex is north of $5 million. Just in terms of the infrastructure you have to put into the labs. We would do all this genomics work, the high performance compute, what have you. Now, I don't operate on thousands of acres. So that's the only box I don't check on the list of qualifying to be a special economic zone.
Okay.
So there's these various very interesting and important institutions that are part of the ecosystem that do not benefit from any of that. And for the fundraising, it also again goes back to the question of where do we get the early stage, and we need to also have tax incentives for angel investors, for those guys who are really taking the early commercial risk and especially the technical risk. They are not considered in our ecosystem at this point.
I want to move the mic to Karen quickly, and then Professor Keegan will ask the question. And remember those things. It's amazing how you can tease out interesting ideas when you push them. And some of the things you have said. You have a question too, right? Okay. So Professor Keegan, so Kiran, and then we'll go Professor Keegan.
Sorry, just a very quick point on access to capital. So some of you may have heard of the UK-Kenya Tech Hub, which is based at the High Commission here in Nairobi. They do an excellent job of working with startups and kind of supporting Kenyan entrepreneurs. And just last week, in fact, we took 8 Kenyan startups to London. So there was a mix of health tech, climate tech, agri-tech companies, and they were sort of matched with VCs and pitching to VCs in London last week. So just on the theme of KUKA and UK-Kenya collaboration, so that is also available as an opportunity to entrepreneurs here as well.
Where's Dr. Machoka? Yeah, anyways, you know yourself. You see all those opportunities for you to build your... Dr. Keegan, Professor Keegan.
Thank you very much. I have two questions and a comment. The first one is to Dr. Karanja. Sorry, I came a bit late. Where we are going now is personalized medicine or precision medicine, and indeed you talked about like oncology drugs with narrow therapeutic index, where we know the toxicity of some of them would actually be killing the patient, okay? Because of our genomic profile, which is largely unknown. I agree with you entirely on that, especially East Africa. Now, now they are worldwide, they are being rolled over. The question is this: the cost of A, the cost of analyzing, B, the availability of those resources, ability to be used, say, in an outpatient setting, which I saw in South Africa recently, where you can just use swab. Yeah, swab, just to understand the dosage. How affordable are they now in Kenya, and can they easily be rolled out, and can you team up with SHA or any other person? Because that's where we are going. I can talk about CNS drugs, where you have like a dose between amitriptyline 20 and 120, depending on the genomics. You can see, so for the other one, it will be toxic, etc. A. Number two, I heard about Muratina. I was somewhere in Europe presenting my paper, and somebody was presenting something which he had gotten from my village. And he had patented it. It was like a herbal from a plant species, stuff like that.
It's interesting.
Now, we know the story of genes, what was taken out of Baringo and the others. How will we protect our products in Kenya? And maybe that's to Chelule. Is there a way that now we can protect our knowledge here, so that I know people will collaborate with the others, but at least so that we get some funding, you know, from side towards back the country. And my last one is a comment. I am shocked, and indeed both of us, that what you have said is not available to the public in public domain. People don't know that those are, facilities are available, like the 20 million. Thank you very much.
Great. And then Dr. Otara, and then we'll move.
Yeah, thanks so much. Yeah, my name is Otara from Egerton University. Thanks, Lucas, and the panel. That's been a wonderful presentation, eye-opening. Just like Lucas asked, how much of this information is out there, particularly from what you have presented from the special economic zone. It's really very positive for people who want to venture into production. But there's paucity of information. Do you have a forum where people out there get to know this? Number two is rather a comment for us people in universities. We currently are running parallel programs. You are in education, you are in engineering to produce an engineer, we're in medicine. But when it comes to where things seem like we must now run away from these parallel things and start producing people who are across. An example is exactly what you've just said about devices, the medical devices. Not long ago in my faculty, we had a laboratory, a simulation lab, but we kept getting our mannequins, our things breaking, and you put them aside and you start looking for money to buy others. But we had this 3D printer, but it was just lying there because we didn't know how to use it. Then one day we got engineering students. Somebody came. We have a lot of resources in universities. I'm just looking back at us universities. There's computer science. There is engineering departments, medical departments. To what extent are we collaborating within the universities, and how best can we do this so that we have hubs, particularly in the whatever we are discussing today? Can the universities be even special producers? Can they also be given economic zones? Can we have all these kind of things coming up in our local universities? Thank you.
Thank you very much. I think that's those people who are here from the colleges. How do you make sure that that works? Because that's very important. There's two more questions, and then we will wrap. I know everyone is hungry. I'm sorry about that, but this is interesting information, isn't it? Oh, okay, we'll come to it. Oh, sorry, it was her first. Let her, just hold her first. Just speak.
Okay. I'm really loving the conversation that we're having. So Prudence, I don't know if you can hear me.
Yes.
Okay. I am Prudence Ibida. I'm a student and a beneficiary of the medical device innovation at Kenyatta University. So I'm really interested about the commercialization of your IP in regards to the ideal pathway that you mentioned that you were able to commercialize your IP. What was that pathway and how it for you to commercialize your IP? And then lastly, I wanted to know about, now this question goes to Karanja, in regards to bankability of your innovations, the safeguards that an innovator needs to put in place when you're thinking around having VCs probably invest into your innovation, something like that. What are the safeguards that I can put in place?
Okay, thank you very much. And then Sam on this side. Professor Mahesh, go ahead, please. And that will be the last one.
Thank you so much. My name is Maureen Jiru from Pharmacy and Poisons Board.
Yes, yeah, regulator.
The Division of Medical Devices. I've had your experience in regulatory affairs, BSI, and I just wanted to know what are the skills that regulatory affairs professional can gain so that we can work around these issues of IP and tech transfer, or what can countries, regulatory authorities do or collaborate with IP and tech transfer to ensure that we just don't support innovation, but we are bringing in products that are safe and also effective in the country.
Great. Safety. Dr. Professor Mahesh.
Thank you. A great conversation. Really, really pleasing to hear this kind of conversation, because this is fundamental in a country growing out of where we are. Now, an important stakeholder who possibly should be part of this conversation is the Kenyan diaspora. So my question to the panel, because every comment that is made, most of the comments ends up in capital, funding, etc. So an important component of important stakeholder who should be part of this conversation is the Kenyan diaspora. So my question to the panel is, conversations between people here and the Kenyan diaspora can happen in two ways. One is a serendipitous meeting, airport or a restaurant or Masai Mara or wherever. People meet and conversations happen and it builds on to something useful. The other way is an organized way in which, in a planned way, people bring the different stakeholders together. So the question to the panel is, which is the preferred way? And I'm sure, please don't say both are equally important. I want you to put, and also if an organization like KUKA has a role in bringing a systematic conversation together, whose responsibility is to make sure that KUKA functions effectively? Is the onus on the Kenyan side, or is it in the UK side? Because at the end of the day, it is Kenya, UK that plans, Kenya with a capital K.
So, okay, so did you write the questions? Do you know who's going to ask who's going to answer which one? Oh, okay, we're going to repeat the questions again. So we're going to have, I wonder how to do this. Regulatory, I think I'll start with Wamboi, you'll do the regulatory, and then Karanja, you had specific questions to you, and then there were specific questions to Chelule, and then I think Karen, the policy thing kept on coming up. I think we'll do that, and try and people are looking at me like, well, yeah, I need to go eat. So let's package it really well. Yeah. And I'm still looking, whoever has the knowledge of the number of how many Kenyans do we have in the diaspora? I'll do a little math and then we'll finish. Just how many diaspora Kenyans do we have around the world? Please, and then we'll do some math. And then we'll finish with the math. Okay.
Thank you. On the regulatory question, which I think is a really great question, that has to do, especially when you're talking about safety of products. Because one of the things that has been my experience is that we get products that have been approved in the rest of the world, in the global north. That does not mean that they're appropriate for use in our environment. And I'm sure everyone is aware of that. And I think that one of the things that I would say about that is that I think, Karen, you talked a little bit about health technology assessments, and I think we need to do a deeper dive into health technology assessments to be sure that the fact that something is US FDA approved or CE marked or whatever does not necessarily mean that it's a product that should be in our environment. So that's sort of where I would start in terms of safety, because we have a different environment than what it was approved for. I'd also like to just comment very briefly on the commercialization of IP, just with a statement that if you're solving problems that people actually need solved, the IP will follow and you'll be able to commercialize it. So as opposed to going after IP, go after solving problems, get IP, and then commercialize that.
Go after solving problems.
Okay, so I think there was a comment or question over here about protecting products from Kenya. So I know there's a GI bill, so Geographical Indication Bill, that I think is with the CS at the moment, and it'll be coming up for public participation soon. So basically, protecting GIs, for example, so Scotch whisky, for example, has a GI, Parmesan cheese, etc. So I think that's something that the Kenyan government is working on at the moment. I think Pharmacy and Poisons Board mentioned BSI, so the British Standards Institution. And in fact, we are doing some work with them here in Kenya, Wangari, the leather sector, and something else, but I can't remember. But I think there's more we can do with BSI, so that's something we can take back as the High Commission. And I think the third point was the question from Mahesh about random diaspora conversations or convening, who has that responsibility. So last year we held a regulatory workshop. We're going to have another regulatory workshop this year, and unsurprisingly, my preference would be to hold that on IP. So I think watch this space on that one. Thanks.
Thank you very much, Chelule. Dr. Chelule, just a quick one, please. We want to finish very quickly. 1 minute, and then
I'll run over quickly.
Yeah. 1 minute.
A few years ago, I think there was discussion on the policy on biological asset led by National Museum of Kenya. You'll be able to look into that. There are a few institutions that have proposed to set up special economic zones. One national polytechnic and one university. I'm happy to see the graduate of MDI. For 3D printing, it's a very good technology, and I would encourage that this could be a shortcut to some of medical diagnostics. On the skills required for the regulations, it's a multidisciplinary area. You need doctors, you need engineers, material scientists, nurses, the whole value chain of people, because they are involved in different places. Some are deploying the resources, some are constituting the material to make this. So you need almost everybody. I like the idea of diaspora.
Okay.
They can be easily mobilized to deploy the resources.
You did it in a minute. That's good.
So mine was very quick, 2 questions. One on
1 minute also.
What is investable? I think investability for me is driven by 2 things. First one, what is the market size? I need it to be targeting at least a market size that in terms of total available market, at least $1 billion. So that by the time we're talking of your serviceable and obtainable market, I can see as an investor within 5 years, I'm going to be able to get my return when I invest in you. So I always think of it from the market size primarily. The second thing is, do you have a team to do it? I'm an early stage investor, so I look at the technology, but I also look a lot more at the team, because early stage investment, we're really taking a bet on the team. We know plan A won't work, B may not work. We need a team that has the perseverance and the fire in the belly to actually persevere through that. So that's the second. The question for Prof was very simple on the issue of the cost for pharmacogenomics. And it's a very interesting, I don't have a clear answer, but what I can tell you, we've already launched pharmacogenomics for prostate, for breast cancer, and for ovarian cancer. Right now, what the current cost is probably around, I'd say about 130 to 150,000 shillings. Why? Because the requests come in 1 or 2 at a go. So when I look at the cost of it from a sequencing perspective, I'm burning a flow cell for 2 people.
Okay.
If I could get volume, we can drive down that cost to below 100,000 shillings. And the cost is typically the same. Just finish. Just a quick one, because if you think about it, It sounds expensive, but what's the cost of the full regimen of the chemotherapy? It's around the same cost. But what if it's the wrong one? And so the question for me is, what, sometimes cheap is expensive, and we need to be able to understand how to be not very penny wise and dollar foolish in the way we think about the health system. So it's actually cost effective to invest in pharmacogenomics. The volumes will drive down the cost.
Dr. Karanja, I understand. You actually, I'm going to use your own term. You said the capex counts, right? If it's $1 billion, right? So if the market is big enough, then it should actually reduce the cost, right? Okay, so the last thing I'm going to talk about before I do the math I was talking about, I'll have Dr. UJ to say, sorry, UJ, my brother, to say, what is a bankable project in a minute? Because you see a bankable project as soon as you see it, right?
You do. I think look, it's multifaceted in terms of assessment. But if I was to try and distill it down, it's assessed on impact, right? I think that's a key criteria to assess a bankable project. It's either got to be transformative or scalable, right? So one of those two things have got to be true, but ultimately impact is what it's assessed against.
Great, and that is solutions. So we need to move away from looking for answers to looking for solutions of the challenges we have. And you find a solution, you have a market. The math is about 4 million, about 4 million Kenyans, right? 4. Now, we have KDA here today, Dr. Shemo Cholo, with 4 million. Just let's do this math together, 4 million, right? If we are able to rally $10 from each, how much is that? Come on, math, come on. $10 from each Kenyan out of the 4 million. How much is that? 40 million what? Dollars, right? $40 million. Supposing we say 100, that's 400 million, right? If we have capital like that coming into this economy, what difference would it make? I mean, I think there's an economist here, Dr. Kibonge, Mr. Kibonge is here somewhere. I think the multiplier effect in Kenya is what? Anyone knows? About 3? So for every dollar that comes to $3. So think about it, if they bring in $40 million into this economy to do this, what we're talking about, that's about 120 effect plus what the taxes will come out of that. So if you look and see the value of doing that, it is huge. And that's what I was going to say. So I'm going to give one person, please a minute, right? I'll give you a minute. Can you take a minute? Sure. Okay, so I'm going to give Dr. Shemo Cholo a minute, and then from there, we will be finishing.
Thank you very much, UJ. Incidentally, we just signed a MOU with Bupa Health Insurance for diasporas. There are, of course, 4 million Kenyans. Diasporas bring into Africa every year $100 billion. 30 billion into Egypt, 25 billion to Nigeria, 9 billion to Morocco, between 3 to 5 billion into Kenya, Ethiopia, and Ghana per year. For Kenya, it's actually more than double what we get from all FDIs and ODA put together. So diaspora is really like the major. But the trouble is most of it, 75%, goes into consumption. And our goal is to see how do we get that to grow from 25% to 50% in investment. And of course, lastly, the returns you get in Kenya, you're talking double digits. It's not even unusual to talk of double digits per month, particularly if you leverage health informatics, AI, and stuff. I'd be more than happy to discuss. Lastly, the perpetual engine is the way to go, and I'm more than happy to discuss that.
Thank you very much.
Thank you. Come on, a big round of applause for...
1 minute, please. Go for it.
Big round of applause for this team. The moderator par excellence, Dr. Lucas, with the interrogation, and this very special team of panelists we have here. And I'm going to invite them this afternoon because the conference now positions an interesting dichotomy. The medical tracks will continue in this plenary hall this afternoon, but the investment track, which will take place in the Acacia Room on the other side, now comes to life. Within that investment track, we have a number of pitches from entrepreneurs, innovators, and I think if this could be a teaser, this is a preamble to the investment track. So I want to welcome you all. If you're from the UK, it'll be the difference between taking the Jubilee line and the Northern and Circle line. Yes. If you're from Kenya, you're taking the SGR or the meter gauge line. So it depends which track you want to take. We're okay on the meter gauge. But thank you. We're going to have lunch for a period of probably up to 2:30, 2:45. Then the session will thereafter continue. Please, those of us who want to participate in the investment track, it will take place in the Acacia Room on the other side in the main hotel complex. So looking forward to see you there. And Dr. Lucas has something to add.
I just forgot to say, first of all, I didn't introduce myself. I'm Dr. Lucas Nyabero. I forgot to thank them, so we give him a hand clap. I just walked away, which is, they've given us a lot of good information.
You're forgiven, you're forgiven. You've got some very special people here. They've introduced themselves, but even my friend who made it here, Dr. Ken Chulule, come on, give him a round of applause. You know how expensive it is to get land in Kenya for anything. Yeah, this man, he's our Quasimodo. Yes, he is the curator of all Kenyan lands that are owned by government. So talk to him. He's here briefly. I want you to interrogate him over lunch hour and find out if you have a project that meets the criteria and has a strategic fit, to have a discussion with him, to have it in his special economic zones at Naivasha, at Technopolis, Konza in Machakos, or Dongukundu there in Mombasa, of course. And the others will be joining us in the investment room because we'll have a plenary session there. Thank you very much once again. A big hand of applause. Lunch is served. Can we have, where's Elder Amere? Can you come and pray for lunch, please? Thank you very much. Yeah? You know, we Kenyans are very religious. Huh? We love the opium, so let the blessings flow. Yeah? Dr. Amere, thank you.
Thank you very much, Aaron King. Shall we pray as we bless the lunch? Because after this, we are breaking for lunch. Let's pray. Loving Heavenly Father, we thank you for the beautiful morning session we've had, the many contributions listened to. And as now we are transitioning for lunch, we pray for a special blessing upon the lunch, that it may nourish our bodies, for we pray with thanksgiving in Jesus' name. Amen.
Thank you. Lunch is served. Karibuni.